Sorry, because of network issues, he is unable to join us. He'll be joining us shortly. Okay, without wasting much of your time, I would hand over to Ms. Parmeet Kaur for continuing the program. Thank you.
Good morning, everyone. Presented over here, I am Ms. Parmeet Kaur, working as a nursing tutor at One Week College of Medical Science, Bhira, Lakhimpur, Kheri, Uttar Pradesh. So, I would like to introduce our first speaker for today webinar, Dr. D.E. Bhaskar Raj sir. Bhaskar Raj sir has more than 20 years experience in nursing field. He has completed his bachelor degree in nursing in year 2000 1999 and master degree in mental health nursing in year 2005 from Dr. MGR Medical University, Tamil Nadu. He has completed PhD nursing from Indian Nursing Council, New Delhi in year 2020. Currently, he is working as a vice principal at Indira Gandhi School and College of Nursing, Amethi, Uttar Pradesh. He also connected with many universities as an external examiner and for setting question paper and evaluating answers top copies. He holds the membership in learned societies like Tamil Nadu Nurses and Midwife Council, Karnataka State Nurses Council, Trained Nurses Association of India, Nurse of India, Indian Society of Psychiatric Nurse. He has attended and participated in various conferences and workshops in state, national, and international levels. He has also published articles in national and international journals. He has also authored more than 10 nursing textbooks. Once again, I welcome Dr. D.E. Bhaskar Raj sir for webinar and hand over the session him to share the strategy of overcome substance abuse. Welcome, sir.
Thank you, ma'am. Good morning, one and all. Audible now?
Good morning, sir. Yes, sir. We
I think
can
audible.
audible.
Yes, sir.
Yes.
Yes, sir, it's audible.
Yes. Thank you, one and all.
Good morning, sir.
Good opportunity. First, I like to give the big thanks to our managing trustees of Good Beat College of Medical Science, chairman and vice chairman. Yes, chairman and vice chairman, and our principal sir, Mr. Sandosh sir, as well as organizing secretary, Mrs. Sweta Rani ma'am, and all the team members of One Beat College of Medical Sciences. This is my privilege and honor to present the topic at such a wonderful day, World Mental Health Day, October 10th, 2020. So today my session, I like to discuss following topics. World Mental Day, about little preview I going to give. And next I like to discuss my topic, substance abuse. In that I like to go with little detail, epidemiology, list of substance abuse, effects and diagnosis, how to overcome from the addiction, and our role, nurses' role in substance abuse. World Mental Health Day 2020. You can know little history of that, general information of World Mental Health Day. Actually, the World Mental Health Day started 10th October 1992 by the World Federation of Mental Health. From that, all the year 10th October celebrating World Mental Health Day. There is a small glance of mental illness about the general prevalence. About 450 million people live with mental disorders. In this leads to the severe ill health as well as disability as per WHO World Health Report 2001. One person every four will affected any kind of mental disorders like mental psychotic disorders, neurological disorders, substance abuse disorders. It is almost 13% of total global burden of disease. World Health Day, World Health Organization 2018 state that every 40 seconds one dies due to suicide. So come to now history of detail of our World Mental Health Day 2020. Actually, today the theme given by Health Federation, mental health for all, greater investment, greater access. It leads to everyone, everywhere. Yes, this is you know very well. Last few months, you are suffering so many challenges due to COVID-19 for our healthcare workers, providing care in different circumstances, going to work fearful of bringing the COVID-19 home with them. For students adapting to taking the classes from home, they have little contact with the teachers and their friends and anxious about the futures. The workers whose livelihood are threatened, and vast numbers of people catch the poverty, and people with mental health condition may expressing even greater social isolation than before. And this is where say nothing managing the grief of losing a loved one, even sometimes without being able to say goodbye. So this is happened last few months, the mental health issues for the all the people in global wise. So that's why the theme is intersecting that investing the no greater investment required in triple M, money, material, and manpower. This is currently required to make health for all the world. The money means so many funding is required for the give the mental health, and manpower like you nurses, healthcare workers, and psychotic nurses, psychiatrists required for more counseling the general population, all the people required now current situation, psychological issues going there, also manpower required, and material, the facilities. So for the great investment leads to the great access. So the great access coming, then everyone and everywhere they can be get the benefit. So with this, I move to the my topic, that is substance abuse. Yes, this is a little vast topic. But it is a very important and very energetic topics to the youngsters, because it is the most of them. You can see the some statistics, the suffering the severe substance abuse disorders. We'll see now introduction. Substance abuse, generally known as drug abuse, is use of drugs in amounts or by methods which are harmful individual and others. It is a form of substance related disorders. Drug abuse is a complex phenomenon. It is not single phenomenon. It is built with so many factors like social factors, status factors, cultural, biological, geographical area to another area. That is also geographical, historical, and economical aspects. So these are the factors linked with drug abuse. The addiction is brain disorders, brain disease that is manifested by compulsive substance use. Compulsive means you know very well, irrational, repetitive act. Okay, they will do irrational, repetitive, persistent act they take the substance use, take the medicine, drugs, despite harmful consequences, health problems. The simple definition of addiction defined as state of periodic or chronic intoxication. That intoxication means like develop the toxin in the blood body produced by repeating consumption of drugs. So you'll see now the second one is the classification of substance abuse. You'll go with the logical one. You know very well ICD-10, International Classification of Disorders. 10th edition says that the F chapter 10 to 19 deals with mental and behavioral disorders due to psychoactive substance use. This is my topic also. The psychoactive substance use consists of following items or drugs. Like first one is alcoholism, alcohol, opioids, amphetamines, sedative and hypnotics, the barbiturate and benzodiazepines, cannabidiol, that cannabis you can say, cocaine, hallucinogens, that is very common is LSD, lysergic acid, diethylmide, nicotine, cigarettes, that's and all, others stimulant. So you see the epidemiology. You see the epidemiology itself. You know why this topic is very valuable for today. You see that 20.2 million adults aged 18 and older with the past year substance use disorders. You can see the circle. There are two circles and a big one, yellow color. It is almost 16.3 million adults the past year alcoholic along with the substance use disease. 16.3 million. In that area, 16.3 million alone, 14 million alone for the alcoholic, 2.3 million people for the alcoholic with the illicit drugs use disorders. Another one, linked one, that is that small circle. It's consists of 6.2 million adults suffering the past year illicit drugs with the alcoholic. In that area, you can see 3.9 million adults with illicit drug alone the disorders. You see a little bit epidemiology in detail. Psychoactive substance use poses the significant threat to health, social, society, and economical money aspects of the family, community, and nations. Globally, prevalence of alcoholic use disorder significantly higher than the drug use disorder. Generally, alcohol and drug use disorder more common among males than among females. These psychoactive substances, there are three psychoactive substances have different disease burden on different age group. Number one, illicit drug use. They cause mortality earliest in life. Early life they will going to die. Alcohol, mainly 65% before age of 60 will come, they will cause the death also burden. And 70% of tobacco death, nicotines occurs after age of 60. According to UN report, 1 million heroin addict are registered in India, and unofficially there are as many as 5 million people not registered, not reported any type of treatment. 1 minute. According to WHO report 2002, nearly 9%, that is 8.9% of total burden of disease due to psychoactive substance. In that 8.9%, in that tobacco accounted for 4.1%, alcohol 4%, and illicit drugs for 0.8% burden of the disease. According to WHO 2002 says that 2 billion alcoholic users, 1.3 billion smokers, and 185 million drug users globally. So you come to the current scenario, current prevalence. The WHO report 2019, the harmful use of alcohol result 3.3 million deaths every year due to alcohol. Averagely, every person in the world aged 15 years and above, they drink 6.2 liters pure alcohol per year. Less than half of the population, that is some 38.3% actually drink the averagely 17 liters alcoholic per day per annual. Some 31 million people have alcohol drug use disorders globally. In that 31 million people, no, in that 11 million people inject drugs. In that 11 million people, there is 1.3 million people living with HIV due to injection drugs, 5 million with the hepatitis C, and 1 million both HIV and hepatitis. These are the prevalence, major prevalence. Come to WHO recent study says that every 10 seconds a person dies from the alcoholic related causes, including cancer, heart diseases, traffic accidents, and violence. Come to the India. What is the prevalence of that? 40 lakhs registered drug addicts in South Asia. Among these, 1.25 lakhs are in India. In that 1.25 lakhs, you can see the prevalence distribution of substance abuse. Alcoholism 42%, opioids 20%, heroin 13%, cannabis 6.2%, others 1.8%. Majority of drug addicts aged between 16 to 30 years. You just listen, 16 to 30 years, all are the adolescent and young adults. These drug abusers are mostly unmarried, and most of them low socioeconomic status people. Among these drug users, 33% are engaged in antisocial activities. That you know very well. Antisocial activities people also. Come to our state in Uttar Pradesh, Dubai and Honda, they reported that 22.8 per thousand are dependent of alcoholic and drugs, while Tagore from the Lucknow gave the figure is 18.55, that is nearly 19 per thousand population suffering the drug and alcohol. In rural population, Uttar Pradesh, alcoholic was found to be most commonest substance abused, 82.5%, followed by cannabis 16.1%. According to Ministry of Social Justice and Empowerment, says that 46,410 cases in substance abuse by street children are reported in in Delhi last year. As per the records of National Crime Records Bureau, says that 53 and 34 unnatural deaths of children between 18 years are recorded due to the drug abuse overdose of the year of 2015 and 16 respectively. There is a small study by the Ministry of Social Justice and Empowerment in collaboration with AIMS Delhi. They find some key finding. One is India is home to 6 crores alcoholic addicts, more than population of 172 world nations, including Italy. Alcoholic is a condition require medical attention. Yes, alcoholism is alcoholic is a substance. Alcoholism is a chronic disorder. It is required medical attention is very important. But unfortunately, India, they get only 3% of people only getting the treatment. Nearly 97% still they not get the proper assessing the medical help. There is a large number of people in country addicted various drugs. More than 3.1 crores Indians, like in our population take, nearly 2.8% have reported substance abuse like cannabis products, bang, ganja, saras, heroin, and opium last year. Unfortunately, 1 in 20 drug addicts are getting treatment. Nearly 19 people among the 20 still not get proper medical help. Next key finding says that in Punjab and Sikkim, the prevalence of cannabis disorders is higher than the national average. It is higher means not a single higher. It is the more than thrice times is higher. National level, heroin is most commonly used substance abuse, followed by the pharmaceutical opioids. Less than 1%, nearly 1.18 crores people use the sedatives, non-medical, non-prescription use. These are the studies says that what is the worry means. These all the prevalence among the children, adults is more than the adults and old people. These problems addicted children is more prevalent in Uttar Pradesh, Madhya Pradesh, Maharashtra, Delhi, and Haryana. So we'll go to our topic of mental illness. Substance use disorders with mental illness. These both are friends, one to one, the co-occurring disorders. Substance abuse is there, they will prone to get the mental illness. Mental illness people, they will acquire the any one or two substance use disorders. You can see my slides, you can get that the human both are approaching mental illness, approaching to the human as well as substance abuse, both make to the comorbid disorders. That is known as dual diagnosis. I'll go now. Spectrum of psychoactive substance use. What is the spectrum? Is just to see the any substance abuse, maybe alcoholism, opioid, cannabis, heroin, whatever. First, the use for the beneficial use, like treating the encouraging our friends or moderate consume the small amount due to the party, due to social impact, due to the spiritual. So like that, the positive health they will take. After that, they will go little time. They will be taking occasionally taking many 2 times recreational, casual. So they will take a social effect. They will take that condition known as non-problematic condition. Next one is a problematic condition starts now when they develop the abuse, when they develop the addiction, that they will have the physical dependence of the drugs, physical dependence of the substance, they will be develop the problematic condition. It's like unable to drive, binge of drinking, consumption, harmful administration. They will have the withdrawal symptoms. So these are will start. After problematic, it's go to the it is called the substance use disorder, otherwise known as chronic dependence disorders. This is a 4 stages: beneficial use, non-problematic, problematic. Problematic means there are 2 also can say, harmful and substance abuse disorders. This stages of progression, same meaning of same spectrum as well as progression of drug abuse. First to know you, then they not use also. Then they will use for recreational purpose, accident purpose. They will be take with the peer group, with the party, or some other incident, worries, emotional triggers. They will taste it. Then slowly they will group. They will take after slowly alone. They will alone they try to take. Then they will addict for that. They will be abuse that. Then it leads to the tolerance, physical tolerance. That is called as addiction. That addiction will come physical dependence also along with that. Then they will come to the treatment that is known as recovery progress. The recovery condition, they are only going to give the choice of the treatment. What are the things going to give? Now we'll see the in that area what are the risk factors of substance abuse uh, drugs. You see the what are the substance abuse disorder risk factors? One is a chaotic home environment, that is conflict and confusion home environment, ineffective parenting, little mutual attachment and nurturing. They're not attachment, mutual understanding, not there, and inappropriate, shy, and aggressive classroom behavior. Academic failure, there are failure in academic conditions, low academic aspiration, poor social coping skills, affiliation with deviated friends, deviated peers. There are no deviated friends group also, they will teach the substance abuse. Perceived external approval of the drug use. Nowadays, this is a very common. Once upon a time, Indian culture, alcohol is evil. You not take. Now is entire society-wise, government-wise, there are approved certain kind level. That is only leads now the so many issues. Parental substance abuse or parental parents also taking alcohol into home. This is now commonly happening now. So parental mental illness, this also genetically comes to the child. So what is the protective factors? How we can see? This is given the topic, how to strategies to overcome the addiction. This is also one of the overcome addiction. Strong family bond. Bonds, family bonds are good. I have to give. Parental encouragement the child life. Yes, parent, father, mother give the engagement to the child life. They will be sit together and bond, develop a bond. Clear parental expectation give to the child, tell to the child. Open discussion to the child, academic success and failure, everything. Teach them how to face the failures. Okay, these are things. As well as strong bond with the pro-social institution. As well teach them. They will be bond with the school, church, temple, and community peoples like that. They will be divert the behaviors like that. So they will. These are the factors may prevent the substance use. I not go as a detail of the causes now. I going to just give the picturized causes to you all. The common reason for the adolescents for the substance abuse: boredom, peer pressure, social anxiety. Now you see the corona, COVID-19. New trying for new things, that is also boosting concentrations, grade. They want to show the social status, control weight. Also some other trying. Another main thing, this is my slide I like to present to you all. This is integration of old joint family system. Joint family nowadays is moving. That's one of the reason for substance abuse increasing. Absence of parents love and care in the modern families because both parents are going for working. Decline of old religious things, moral values, everything now decline. Decline means decrease. That's why these are the leads to number of alcohol addicts for the problems. Now you can see this picture is how it's addict will short. You see the causes of biological cause, the environment cause. What are the causes? Will come to the substance abuse factors. There are 5 important things: route of administration, effect of drug, how much this affect, rarely use, availability, and cost. It leads to brain mechanism. Brain mechanism, dopamine and epinephrine act is adapting this substance abuse. This leads to the addiction. It is the brain mechanism only creating the craving. Craving is there. Let's come to the addiction cycle. These are the 5 important factors is there. In that emotional triggers, any emotional problems leads to craving. Craving means I told strong desire. Yes, I want a rituals regular using that, and regular pattern of the taking addict to that, that is called using. Then guilt is they will feel, yes, I am doing mistake, I want to come out. So this is a guilt. So this is a cycle of addiction cycle. This is also helpful you from how to overcome the substance abuse. Come to, I go past this one, severity of problems or damage. Damage for individual, severity of problem for individual caused by substance depends on type of drug abuse or duration of drug use. What type of drug, how long they're taking. These 2 factors only deciding the severity. The following factors will linked with the severity or damage of the person. One is age. The age is more common for the adolescents and above age of 50 years. Nutrition status, living condition, poor quality and inadequate food intake, unhygienic conditions, poor access the health care, low socio-economic status, slum conditions. These are leads to the severe damage, severe problems of individual. Health conditions prior to the abuse, before the addiction of the drugs, condition, physical condition, it's a good physical condition before addiction. That person will get the less severity problems. Those are before the addiction of the drugs intake. Their poor health means they will get more severe damage, side effects, and genetic bonding. Yes, family history also very important for the substance abuse. Any hereditary or fathers they addicted, it leads to the more common for that people get the severe damage than compared with the not genetically linked with the parents disorders. And what are the complications? You can see the complication 2 ways. One is medical complication, another one is psychiatric complication. The medical complication is a problem due to the intoxication. Intoxication is there's that body getting the toxin effect, the drugs effect in the body. It leads to the mood changes as well as the negative feeling creating, and it leads to the violence. And driving the vehicle, operating machinery leads to accidents. Poor judgment, poor coordinations can cause the physical injury, even death. It is also. Perceptual distortions and can result, that is, hallucination and illusion may be get, and that leads to accidents. Acute intoxication reactions, coma, and overdose death also. Problem due to the withdrawal symptoms, withdrawal conditions. So physical withdrawal also may cause the so much problems for the individual. You know very well, the alcohol withdrawal, you know three things: delirium tremors, rum fades, alcoholic hallucinations. Like that, even all the substance abuse, there is a withdrawal, sudden stoppage of substance abuse intake. They will suffer the side effects, mental disorders will develop. Psychotic disorders associated with the substance abuse. Psychoactive substance can induce psychotic disorders immediately after. It's like friends, I told, comorbid disease. Systematic disorders, you can see terminological side effects, complications. When same vein using the injection of injection substance abuse, they will get the they get the marks in the vein, discoloration of the vein. That discoloration of vein known as needle track. You can say needle track. Tatting and scarring the injection site. Use the injection needle can cause the infection in injection site, and as well as they will get the pruritus and dermatitis also. Cardiovascular complications, you can see infection in heart, blocking the circulation, because the same injecting the needle, they will get the blood clot, air bubbles, emboli can form, then block the blood supply to the vein. Ventricular fibrillations also can cause it to go into the shock and death. And pulmonary complication, you can edema, pulmonary edema, aspiration edema, pneumonia, bronchitis, pharyngitis, pneumonia, and TB, tuberculosis, also common infective respiratory disease. I think these and all you already suppose you know this way. I go a little fast. Hepatic complications, liver related things. Hepatitis B, C, and D. These are the things, blood borne infections. So transmitted through the sharing the needle. Alcoholic hepatitis and fatty livers, cirrhosis, alcoholic cirrhosis of liver, hepatic trauma also develop. And the complication in the reproductive system. The incident develop STD disease more common among them. Drug abusers. Drug abuse leads to decrease the sexual drive as well as cause impotence. Reduce the female means reduce the ovulation and menstrual abnormality can see. Female born to the mothers, children born to the mothers who abuse the drugs or alcohol, they will have the delivery time problems like low birth weight and other problems like physical and mental development disorders for the babies. You can see simply that word is fetal alcoholic syndrome also develop. Next one is the neuromuscular complication, CVA, dementia, neuritis, bacterial meningitis also common. Hematopoietic complications, that is blood related. So reduce the count of platelets in blood may lead to the bleeding disorders. Bone marrow depression also develop. It leads the decreased production of WBC. So WBC will be lost the numbers. Poor nutrition status develop the anemia also develop. Endocrine disorders also develop, ganja, opioids, and alcohol abuse, lower testosterone level in the blood. Even diabetic mellitus, blood sugar disorders may increase for alcoholic. Renal functional disorders damage renal cells, cause nephropathy. GI disorders, you know very well, commonly this happen for the alcoholic, gastritis, peptic ulcer due to the poor intake of foods habits as well as affect other drug abuse. Acute and chronic pancreatitis also develop. Incident of cancer in the GI system track from mouth to anus, they will be higher level among the alcoholic. Last one is cancer. The drug alcoholism abuser abuse the tobacco product, cause the high risk for the cancer also. Come to the diagnosis. In the diagnosis pattern DSM-5, there are 11 factors. In the 11 factors, two or more you can consider as a substance abuse disorder. Mild case is 2 to 3, moderate is 4 to 5, severe is above 6. Okay, in this picture you can see that what are the criteria of substance abuse. One is craving to no, they want, craving means a strong desire to take the substance. Next one is they want to cut down or stop the managing but unable to stop. Taking the substance abuse a large amount, longer period also. Neglecting other parts of life work. They are not able to do the work on the schooling and other things. They will always engage with the substance abuse. Continues to use the substance abuse, even the relationship is also damaged. Using substance abuse when it put to you danger, even they getting both danger, even they will be continue. Come to the, I going to short in the diagnosis. The diagnosis, I like to give the new point of view. All I share this point, new one. According to WHO, experts planned now assist diagnosis method that is called assist A for alcoholic, smoking, and substance involvement screening test. This is only 5 to 10 minutes. Do the normally you can do it any setup. This from this assist method, you can identify the tobacco product problems, alcoholic, cannabis, cocaine, amphetamine, stimulant, type stimulants, sedatives, sleeping pills, hallucinogens, inhalants, and opioids, and other drugs are involving screening test can do it. This it will be assessed that how long they're taking the substance or a substance with the associate problems for last 3 months. You can identify. It is have the scoring, low scoring, moderate scoring, high scoring. So there is a low scoring, no treatment required. Moderate is give the brief interventions, and high scoring can referral to special treatment or specialist assessment also. According to the APA, it's one of the best organization for psychiatric side. American Psychiatric Association also given that there are 11 points for the 1 year, 12 month. You can watch this or you can ask them 12 points, 11 points. The 11 points, anyone suffering 2 or 3, it's called this mild condition. 4 to 5, you can go to moderate, as well as more than 6, we can call this severe condition. So, other diagnosis measure is moist and gauge. Moist is Michigan alcoholism screening test, and gauge is already you know. I think gauge questionnaire is cut down. How do you want to cut down the alcoholism or drug abuse like that? If you are experienced annoyed in that area, or you feel the guilty for using the alcoholism, you want to eye opening like that. This 4 points CAGE, that is first letters of each. This of 2% you can start for the treatment. Phases of addictions, there are glunic curve. There is you see the different color also. Progressive color, that taking continuous alcoholism. Crucial is addicted, that chronic is abuse or addiction of the conditions. So after that onwards, you can from that the willing to change recovery. They want to recovery means rehabilitation phase develop, and the recovery phase is a complete restore the person. This is a phases of addiction treatment level. Now we come to strategies to overcome the addiction. I'll go little. Here, this is a two topic I like to discuss. Strategies. One is the management. Another one is the prevention. Management substance abuse. Addiction treatment must. You can use what are the addiction treatment. Help the individual stop using drugs. Maintain drug-free style. Achieve productive functioning in family, work, and society. Patient record long-term and repetitive episode for follow-up care also can do. This is addiction treatment must. What are the principles of effective treatment? What are the principles can use for the overcome? Substance abuse is treatable. Yes, it should be definitely treatable. Treatment varies depending on the types of drugs, characteristic of the patient. Treatments need to readily available. Effective treatment address individual drug abuse along with the medical, psychological, vocational, legal problem also you have to deal. Behavioral therapy, individual, family, group counseling therapies also involve the treatment. Medication are important component for the severe addiction patients, because counseling alone is not addiction condition alone, not useful because they will get the withdrawal symptoms and acute detoxification time you can use the drugs. And individual treatment and service plan must be assessed continuously, modify according to their need. Appropriate duration of treatment depending upon the type of drugs as well as their characteristics. In subgroups like adolescents, women, pregnant women, people with medical and psychiatric comorbidities, sex workers, and social marginalized individuals, prisoners are often required targeted and specialized care needed. Target people, their families, community members, local organizations should be actively involved for planning, implementing, and monitoring drug dependence treatment service. Even crime, there's drugs related to crime, high prevalence. So you can link with the crime justice system also. Then treatment is very effective for that. So I given the picturized these 6 points. Psychotherapy is useful, meeting with the addictions counselor, family counseling, support group, holistic treatment, relapse prevention, like psychoeducation and treatment can give. WHO, there is accelerated one word, it is safer. 20th September 2018, WHO released the safer, a new innovative technique package for the government how to prevent the substance abuse. This point, safer is SAFEAR. S for the strengthening restriction of alcohol availability. So government should be stop the availability, easily available drugs related items, rules and regulations create. Advance and enforce drink driving countermeasures, the driving drivers and other things and all you can prevent, because prevent not only that, the general population, general public also not affected by the drink driving. Facilitate the assess the screening and brief intervention and treatment can provide to them. Enforce ban and comprehensive restriction of alcohol, advertising, sponsorship, promotion, this and all block. Raise the prices for alcoholic taxes and prices to increase the alcohol product can control the alcohol. Come to the prevention of substance abuse. In that area, I like to see the prevention means you also knows very well. There are three important things: primary, secondary, tertiary. The primary prevention deals with the prevention of the substance abuse, and secondary and tertiary level it's go for the reduce the harm, because primary is deals with the how to prevent, how to promote the people. Secondary is start with the treatment, that is early diagnosis, prompt treatment. Rehabilitation, tertiary is a rehabilitation, reduce the substance abuse and give the rehabilitations there. So in this area, I like to inject one new concept, behavioral health continuum care model. It consists of 4 points. One is promotion, prevention, treatment, and recovery. This model, only one model, consists of all the care, all the aspects, treatment, everything given here. You see, promotion. This promotion means there is a primary or a promotion you have to do. Health education, teach the good things, good parental life, like that and all. Child parenting, everything will come promotion. Prevention is a universal selective indication. Universal means common rules and regulation national wise. Selective means district or state wise, and indication is individual person, for the individual person create the prevention point. Next, treatment, case identification, standard treatment can give. Recovery deals with the how long you can give the treatment or rehabilitations. Everything will comes under recovery and after. So all 4 points come together. This is the effective treatment for the prevention of the substance abuse. Level of preventions, I like to compare to prove the WHO. WHO recommended prevention of substance abuse as primary level, early identification, treatment, care, recovery, rehabilitation, and social reintegration measures, along with the measures aim minimizing the adverse the public health and social consequences of the drug abuse. So these are the certain things you have to keep in your mind following this prevention. Number one is prevention of substance abuse induced mental disorders and reduction of injuries, violence. The violence is you can see the domestic violence is due to substance abuse more, and child abuse, general based sexual and other violence also it will increase due to the substance induced behavior. So reduction is the communicable disease like HIV, hepatitis, tuberculosis, sexual related problems. So these are also can complete. And reduction of non-communicable disease, you see the effect of the alcohol and drug abuse like cancer, CVA disorders, and liver disorders. This and that. So these three very important concept why you want to do the prevention of the uh, substance abuse. Come to the primary prevention, it is protect the people and particularly child and youth during the drug initiations by providing them accurate information. So child and adolescents, you give the proper information, develop supporting parenting healthy environment, promoting skills opportunity, ensuring equal assessing education and vocational training. Availability of drugs legislation, narcotic substance, narcotic drugs substance abuse act you can follow. Physicians should be careful and do not to prescribe the powerful action drugs. If you needed, you can give the prescription drug prescription. Through that you can collect, you can see the targeted intervention. You can primary level, family is a very strongest factors protect the child and prevent the risky behavior. School also give the sound value of the child, how to become knowledgeable, teach them what are the situation, how to cope with the situation. Workplace, employer can promote the health of employees also. Rising awareness of drug drivers and it impact road safety, including death, injuries, property damage, harm to other road users among the general population. Mass media. So mass media very important role in the primary prevention. They should create the good awareness about the dangers, as well as there will be danger of specific practice also can be give the in mass media. National level, there are so many programs our Indian government created. Ministry of Health, Family Welfare, and Ministry of Social Justice and Empowerment combined, they created drug de-addiction program. And along with the aims, they created National Drug Dependence Treatment Centers. These also two effective measurements of prevention of substance abuse. National AIDS Control Program also developed the how to needle syringe program, opioid substitution therapy, like that and all. Ministry of Social Justice Environment India, they formulated 2015 scheme is assisting the prevention of alcoholic and substance abuse also. The Department of Revenue, our revenue Indian government, they also created, you know, this one, Narcotics, Drugs and Psychotropic Substance Act 1985, and they created 1988 also Prevention Illicit Traffic in Narcotic Drugs and Psychotropic Substance Act. These both will be prevent the person possessing, exports, or using this purpose and all. It may give the penalty of this 10 years to 20 years of jail, as well as 1 to 2 lakhs of fine also. So various e-based, like our webinar, like that, e-health web-based program also conducting nowadays. You know very well, National Drug Addictions Treatment Centers, AIM also, as well, AIMS also in Delhi, as well as M sessions program, like tobacco section program also started. Ministry of Health and Family Welfare, Government of India also, they started. So you come to the secondary prevention, you know very well, secondary, observe closely, change the behavior of the individual, and early diagnosis and give the prompt treatment, and give the therapies, brief interventions like psychotherapy, behavior therapy, and other no, de-addiction, detoxifications with the benzodiazepines, and motivational interview therapies. These are in combination therapy plan for the secondary level. They prevent the develop the further damage. Last one is going to the tertiary level. The treatment state severe dependence condition tertiary level can use, because here can planning for the rehabilitations mainly. Rehabilitation service to plan based on severity of problems. Family has to involve restore and rehabilitation services. Here family involved. So alcoholic dependent therapy, that is otherwise known as alcoholic sensitizing drugs, we can use there. And other therapies like assertive training, teaching, coping, behavior counseling, supporting, and individual psychotherapy also can use. Here can involve the self-help group. Yes, this is a self-help group. The main strategies to overcome the addiction. It is known as Alcoholic Anonymous, all unknown, all deemed use. And you can have the so many other self groups, narcotic anonymous like that and all. Motivation enhancement involving education and health consequence of use, alcohol use, that also. Next one is very important thing, psychoeducation. In this area, psychoeducation, you can teach the how to overcome from the disease, and you can teach to the family also how the no drug over drug withdrawal symptoms side effect will come. What are the precaution will take? So health education given to the family as well as patient about the side of no treatment of the for the treatment for the psychiatric psychoactive drug abuse. Teach the family, establish trust to the patient, and full range of treatment can involve here, as well as can make the family also link with the self-help group. Last one, I going to complete. Sorry for delay. Role of nurse. This is our role, because without this, I can't complete my topic. It's not good also. Nurse's role in the substance abuse patients. Nurses play a vital role care of patient expressing intoxication and withdrawal stages. Nurses also meet the basic need of safety, hygiene, comfort, calm and quiet environment of the patients. Nurses will be have can administer the therapies as per the order by physicians, help the patient to understand, identify the causes, substance dependence, substance abuse, and need of the life changes. Nurses develop the trust, correct the misconception, do not blame others, identify the maladaptive behavior for the treatment and all. Maintenance of strict self-discipline, oncoming supervision, restrict assessing to addicting substance they taking or not like that. Teach the skill like relapse prevention, supportive skills, developmental sections to teach them. Advice on health hazards of injecting. You can give the advice on the health hazards, what are things will happen. Encourage the patient focus on the present and future, not see the past, particularly substance abuse disorders patients. Behaving the patients with constant manners should be the nurse should follow the principles of non-judgmental, non-punitive manner. Random checking the patient and his belongings, because he may hiding the some substance in the hospital setting. Monitoring the signs and symptoms of intoxication. Violation of any rules must be handled with the teamwork, multidisciplinary teams. And discharging the patient, instruct about the regular follow-up and continue the medication. Advise the patient get the self-help group. Patient may getting the disulfiram. Teach them this is not only for cure the alcohol, it is discourage the drink. You can check before giving the disulfiram, you can check the history of the seizures, severe mental illness, cardiac, kidney, diabetic, etc. And do not use alcohol and other product for 12 hours before starting this, or after starting also don't use any alcohol contents. Patient will get the complication. Explain the patient it is necessary, read the label for use before after taking disulfiram. You can read anything, maybe taking cough syrup or cream applying or something. Nowadays these all the mixing with all the content, so it is also cause the problem for him. Tell to the patient to not use all the containing product, anything for the after treatment of getting treatment time also, disulfiram time, you don't take anything. Explain that small headache and little headache and fatigue, skin rashes may be explained due to the medication adjustment. Any injection of alcohol may develop the blood vision, chest pain, confusion, even go a large amount going to get the seizures of MI, myocardial infarction, unconscious and going to die. So distal from person should have the ID card to carry. So for the nurse's role of substance abuse, patient and family, this is last slide for me. Teaching the patient about the substance abuse, it is affect the entire family. Meeting the potential health problems and nutrition advice the patient and family members also you have to teach. Explain family members about need of care, support and concern towards the patient. Without family support, patient recovery is not possible. It is not complete also. So the family also will be involved in the substance abuse condition. The substance abuse is not a psychotic disorder. It is one of the neurological related behavioral disorders. So the patient to family should need, and because patient can understand also, patient family should have may have the certain misconception. So nurses role is remove it and make both as a work as a team. The recovery will be very fast. So thank you. Conclusion, you can see substance abuse major health issues, not only family, it's community and nation. It's like our India is developing is large population. It is so many issues will be developed. Not only personal ways, society problems, and you know very well so many crimes and accidents due to this incident. So nurses play vital role in developing and implementing drug and alcohol prevention strategies, therapies, how to handle the crisis, how to develop support system. The primary steps must be incorporated the care. I hope you can get certain knowledge my webinar. Thank you for one and all listen to my class. Thank you. Thank you.
Thank you, sir.
Yes, ma'am. Thank you, ma'am. Thank you, sir. Any queries, please?
So there is no query. Thank you, sir.
Thank you, ma'am. Thank you, ma'am. Audible, ma'am? Thank you, ma'am. Thank you, sir. Any queries, please, you can ask me.
Thank you very much, Bhaskar sir, for the wonderful presentation. And the delegates answered very.
Any questions, please? Any audience or any dedicates, please ask me.
Thank you, sir, for inviting us for your wonderful work.
Thank you, ma'am.
Thank you so much, sir. Thank you.
If any delegates are having any questions, you can kindly arise them. Sir, we have one question from Nisha Siviyar. Why the Indian government didn't ban the substances? Why did the Indian government has not banned substances?
This is government. Actually, government have the so many policies. I told actually a little past. Audible, ma'am. I am giving answers. Audible.
Yes, sir, you are audible.
Yes, sir.
Actually, government of India, along with the national family and health welfare, as well as social justice and the empowerment ministry. Also, so many planning they're doing because 100% unable to stop the alcoholic product because no, it's if you are generally speaking very easy, but those are suffered a lot of power peoples, lot of thousand peoples and million peoples all over the world. It is approval, so that's why they will escape. Nowadays we see, they will escape to some government. They will label that if it is drink, it is injuries for health, injuries for damage for family, like that. but policy-wise, it is affect. That's why that is not possible. They slowly can improve. I hope this is government question. No, that's why I can't. These are policy makers will do. Any other questions, please?
In case of smokeless tobacco addiction, what measures can we take? Few comments, please. This question is asked by Abhishek Sadar.
Tobacco
Let's
is
smoke tobacco.
yes, ma'am. Yes, ma'am. This is a no, habitual disorder. So this is habitual disorders. It will be developed at. There is one of the most commonest. I mentioned there are almost 180 million people suffering this condition. So when this tobacco will go, if the proper deviation is, they will be engaged with the other substitutes like nicotine content now using the commercial things, they will be slowly withdrawal. If you have measures directly consumed, you see that there are three words that is CAGE, CAGE. I told you that point. You can 2 point is there are ready. You can go the de-addiction centers. Will be the 21 days for the treatment. In the 21 days, they will be further. They will be remove the intoxication. That is called is detoxification days. From the detoxification days, we can start other substitution. Then after removal of the habit, when the habit is like you can see, if I'm taking alcohol for the long time, the alcohol mixed my blood. Usually it is 7 to 14 days it need to remove totally from the body, but unable to remove immediately. You need slowly with some other detoxification method and they have to remove. So after removal of the toxin effect of nicotine or tobacco, other things, you can go with the recovery amount. You can't, with only one point of view, you can't say psychotherapy or something. Your severity condition must see.
Thank you, sir. We have one more question from Saurabh Chakravarti. Alcoholism is a serious issue which leads to domestic violence in many cases. What measures are the Indian government taking regarding this matter?
Indian matter they already mentioned, no ma'am. But
Yes, sir, it was already discussed.
I like that your as a person's as our role of nurses side come to the de-addiction centers, you will do it. Actually, there are a lot of laws, domestic violence laws, and then it will come. I told last end before end. I told the one point. This substance abuse leads to the any type of this. So you take the any crime is there behind its master plan is substance abuse only. So many issues, so many rape or so many death, so many accident. All the behind that only one reason is our topic substance abuse. So these strong people, strong political people or policy people should decide the action on this. It is preventable only. As per your discuss, it is preventable.
Thank you, sir.
Yes,
Any more questions from the delegates? Okay. Okay, sir. I think we have covered most of the topic we have discussed. It was a very clear information given by you. There are no more questions, I think.
Yes, ma'am. Thank you for giving this opportunity. It's a vast topic. Within the time limit, I can like to complete. That's why I go with without some detail. I see in so many questions and so many participants. Nice to see that. Thank you for you all team. Very nice topic also. Grand scenario. It is very nice. Thank you very much.
It's a pleasure, sir. In a short duration of time, you accepted our request and you cooperated and you did a very good job. It's a pleasure that you share most of your knowledge with us. Thank you, sir, for your motivating word on this addiction.
Thank you, ma'am.
Now
Thank you very much.
Continuing the webinar, next I would like to welcome Mr. Navina J.S. Sir. He is a PhD nursing scholar from MIT University, Gurgaon, and working as a associate professor in MIT University, MIT College of Nursing, and MIT University, Gurgaon, Haryana, India. His area of specialization is in the Department of Community Nursing. He is 12 years of teaching experience in nursing. He did master degree in nursing in year 2010 and BSc nursing 2006 from Rajiv Gandhi, Gandhi University of Health Sciences, Bangalore, Karnataka. He has received gold medal for first rank in MSc nursing from NDRK College of Nursing, Hasnan, Karnataka, and received meritorious award for PhD distinctions from Arya Vasya Official and Professional Associated, Davangere, Karnataka. He has received best paper presentation during national conferences for his research on knowledge and attitude of nursing students on eye donation at Uttar University, Greater Noida, UP during the year 2018. Attended and organized many national and international conferences, seminar, workshop, and term training courses. He resources person. He has shared his valuable knowledge in many national conferences and registration council. He is a lifetime member of TNAI. He is a life member of Innovation Alliance Public Health, the Nursing Teachers Association of India, and Integrated Association of Medical, Basic and Social Scientists. He has consulted with different universities for setting up of and examining the papers. He has published more than 14 research papers in international journal and 2 papers in national journal. He has contributed in Target High 4th and 5th edition under CBS publisher New Delhi. He is a review author for a textbook of Fundamental of Nursing. He is a review author for textbook of Psychology for Nurses and Critical Care under Kumar publisher New Delhi. He is a review author for textbook of Nursing Fundamental for BSc Nursing under CBS publisher. He provided 10 hours of video discussion on community health nursing question answer under CBS Nursing Nest Live in the year 2019. During COVID-19 pandemic, he is presented more than 10 topics in national webinars and interacted with 2,000 plus nursing and non-nursing fraternity under virtual platform Zoom, Google Meet, and Microsoft Teams, etc. Sir, please take over the session. Welcome, sir.
Thank you so much, madam. Just give me 2 minutes.
Okay.
ಲೈವ್ ಬರ್ತಿದೆ ನೋಡು, ನಿನ್ನ ಮೊಬೈಲ್ ಲೈವ್ ಬರ್ತಿದೆ. Hello. Can you able to hear me? Hello.
Yes, sir.
Very good afternoon, one and all. Sorry for making you to wait for 2 minutes. Whether my presentation is visible?
Noted, sir. Yeah, your screen is visible. Yeah, now it's visible, sir.
Now it's visible. Okay. Thank you so much. Yeah. So first of all, I would like to wish each and everyone the International Mental Health Day of 10th October 2020. So on behalf of that one, on the occasion of that national webinar on strategies to overcome addiction, was organized by One Beat Medical Sciences, Lakhimpur. So I would like to extend my thanks to S. Bahadur Singh sir, Chairman, and Dr. Manjeet Singh sir, Vice Chairman of One Beach College of Medical Sciences, and Principal Mr. Santosh SU, Organizing Chairperson, and Organizing Secretary Mrs. Shwetarani CM, and all the organizing team members of today's webinar, and most delighted delegates of today's session. So I would like to extend my thanks to Dr. D. Elakwan Bhaskar Raj sir also for providing information and topic discussion on substance abuse. It was a very good discussion, sir. And now I would like to discuss on a very important topic. Is everybody knows that social media. So we are hang up with the social media every time and everywhere. So man is still the most extraordinary computer of all. It was said by John F. Kennedy. So I would like to play our video for you people. First you watch this video, then I will start my presentation. Sorry, I could not provide you the audio, but you will understand. So I think you people understood from this video. So how individual, any people who are addicted to the social media and their educational performance and all the things. So this is the power of social media. Anything they are going to banish in the society. And just Mr. Santosh, can I get a 1 minute of technical assistance? Santosh? Mr. Santosh?
Yes, sir. Yes, sir. Hi, sir.
Santosh sir? Madam Santosh sir is there?
Yes, sir. Yes, sir. 1 second, sir.
Yeah. You are? ಈಗ ಬರ್ತಿದೆಯಾ ನೋಡು ಈಗ ಬರ್ತಾ ಇದೆಯಾ ನೋಡು
Technical assistant. You can say.
sir, now it is coming, I think. Now I have given the
Hello,
streaming.
Anavik sir.
Yeah, now I have given the streaming, sir.
Yeah, okay, sir.
Sorry, all the delegates and organizers. Just there is a technical glitch between the session.
No, it's okay, sir. We can understand that there is network issue also.
Yeah.
No problem, sir. You can continue the session.
I will continue. Okay. Yes. So I was telling about social media addiction and what are the problems the youth are going to face. So am I audible and my slides are visible?
Yes, sir.
Yeah, okay, thank you so much. So now I will not disturb you people, I'll finish my session. Yeah, social media addiction is a proposed form of psychological or behavioral dependence on social media platform, also known as internet addiction disorder, and other forms of digital media overuse. Social networking addiction is a phrase sometimes used to refer to someone spending too much time using Facebook, Twitter, Instagram, and other forms of social media, so much so that it interferes with other aspects of daily life. So whatever the social medias we are seeing, the Facebook, Twitter, Instagram, WhatsApp, WeChat, and Snapchat, all these are having some limit to use. If we are crossing that limit, it is very difficult. We are coming outside from that one. So there is absolutely no problem and nothing wrong with using social media. Some people use it to check updates from their friends and to stay connected. Some people use it for entertainment and to kill time. The problem comes when someone becomes addicted to social media and overspends their time on those platforms. As a result, their bad habits seriously affected their lives in a negative way, and this is obviously something that you want to avoid. So if we are using more than the required time or more than the more than the time we are using than our habits, than our working schedule, so we will be going to addict. So let's take Facebook as an example. Facebook is the biggest social media and used by the most people in the world. It has 1.13 billion daily active users, and if it represents a country, it will be the most populated country in the world. More importantly, Facebook founder Mark Zuckerberg said that on average, people would spend about 50 minutes a day on Facebook, Instagram, and also the Messenger platform. Well, 50 minutes a day does not sound like much. Yes, obviously, 50 minutes, what all things we can do in 50 minutes. We can finish any assignment, we can write any presentation, or we can do any artwork or anything which is effective for our life and also useful for our life. However, you should understand that there are only 24 hours a day, and an average person sleeps about 8 hours, and this means that 1/16 of an average person's waking time is spent on Facebook. So out of 24 hours, 8 hours we are sleeping in, remaining 16 hours. In that 1 hour we are using for Facebook. But the survey is telling that some people are using 7 hours, 8 hours in a day, 10 hours in a day. So the valuable time we are going to lose in Facebook, in Instagram, in WhatsApp. So many other social medias are there. And coming to the game, so nowadays people are very much annoyed due to the game, that is PUBG, has been deleted and has been removed from the country, and many other games are also removed. So this is a way of becoming an addiction, and also that is making a problem to the people. Spending 50 minutes a day on Facebook will accumulate and become an extremely time consuming activity that will eat up most of our life. Do you know that studies have shown that people read only about 19 minutes? See, only 19 minutes a day on average, and most people spend only about 17 minutes in sports or exercise each day. But 50 minutes for Facebook. It is unacceptable to see people spend more time on Facebook than they do on exercises and reading for improvement. And this is one of the main concerns, and also the reason social media addiction has quickly becoming a hot topic lately. So if you overspend your time on social media like on Facebook, Instagram, or Twitter, you may have become a social media addict. It is just that you did not know about it. Okay, so one of the survey conducted on types of technological addiction, people play online games 60%, social networking 12%, watching videos and download music 8%, study and work only 6.7%, browsing 5%, communication and other 4%. See, we are giving maximum of time to the social media and online games. So in India, coming to our country, the number of social network users in India from 2050 to 2018 with the forecast until 2023 in millions. See, from 2015, I am giving you data. 142 million people are using social networks and they are addicted. See the growth rate of 2016, 168 million, and in 2017, doubles almost. It doubles the number of users, 293 to 296 million. It means around 30 crores of population is using social networks. And coming to 2020, 38 crores, and 2023, we cannot imagine 50 crores of population is using social networks. Half of the population in our country is using social networking. So yes, it is not a problem, it is not an issue to use the social networking, but there are some limitations. Facts from Chicago University. Researchers at Chicago University conclude that social media addiction can be stronger than addiction to cigarettes and booze, following an experiment in which they recorded the craving of several hundred people for several weeks. Media cravings ranked ahead of cravings for cigarettes and alcohol. So here, one of the study from Chicago University saying that the social media addiction is going more and more popular than the addiction of cigarette and alcohol. One of the facts from Harvard University survey, researcher actually hooked up people up to functional MRI machines to scan their brain and see what happens when they talk about themselves, which is a key part of what people do in a social media. Plenty of clinicians have observed symptoms of anxiety, depression, and some psychological disorders in people who spend too much time online, but little hard evidence has been found, proving that social media or internet use causes the symptoms. There is a similar lack of data about social network addiction. So this is another university study they have told. So one of the quotations from Eric Coleman, we don't have a choice on whether we do social media. The question is how well we do it. Now we can't escape from social media. By one or another way, if you are not using, it will make you to use. Okay. So, but how well you are going to select it. So before going to show this slide, I would like to ask the question to the delegates and participants. Just a minute. I will give you 1 minute of time. You have to answer in the chat box. So what may be the causes of social media addiction? I think most of you people know one or another in surrounding, they are addicted to social media. But what may be the causes of social media addiction? Risk factor of social media addiction. Yes, the responses. I'm waiting for the responses. Yes, Tushar has sent loneliness. Okay, exactly. One of the answers, loneliness. Yeah, you'll accept. Loneliness is also one of the risk factor or cause for use of social media. Any other cause? Any other cause of social media addiction? Kasturi Das, seeing pictures of friends. Exactly, you are coming on the track. If you see the picture of your friends, they are going to picnic, they are going to hotel, they are going to bakery, they are going to shopping mall, and they post a very nice picture, and you also want to post. It will crave you to come on social media. One more answer from Akash Mera, no specific work. Okay, there are no work for people. So obviously they are doing the social media. The Joey Singh told lifestyle. Yes, lifestyle nowadays everyone is changing their lifestyle. Then Nisha Gupta is telling that more interest in mobile. Yes. Then Kasturi Das over seeing picture of friends, and Indramani Mishra. Parents are not giving time to their children. That's why they are using social media. Okay. Lockdown. Yeah, obviously lockdown effect. Lockdown effect is increasing more and more use of social media. Online classes during COVID-19. Indramani Mishra, yes, you are also blaming colleges for this online classes. Self-publicity. Okay, that is also nobody want you publicizing you. You want to publicize yourself. Then insecurity, poor self-esteem, recreation, gives plenty of option. We can get any information from this. Stress relief. Thank you so much. So many answers. Delegate, you are superb and you are active listener. Parents are not giving proper time. People wants to have more followers. They want to famous more in less time. Yes, the concentration of videos, YouTube videos and Facebook, they want to have more followers. 1 million followers, 2 million followers, 10 million followers. One of the small story I would like to say, one of the Facebook YouTuber, he was admitted in the hospital. He's an ICU. He's having friend circle of around 5,000 in Facebook. But in hospital, his wife and his daughter. See, this is virtual life. This is like one of the temporary life. After his death, only his close relatives, 10 or 15 people came, friends came, and he finished his cremation. So, what about the 5,000 friends? Where they have gone? They will just forget. They will delete the account, or they will not see his post. They will think, and they may say that they will put home or RIP, rest in peace, and they will forget you. So, friends, students, I will tell the social media is not a good choice if you want to live. So you try to stay safe from the social media, Facebook, and also Twitter, and also Instagram. I will tell you. Thank you. I could not read all the answers. I am getting more than 25 answers for this question. Please read in the chat box. And now coming to the next, I will be interacting you within a 15 minutes. Next question is coming. So after getting your answers, I don't want to show this slide. Causes of social media addiction. Okay, anyway, I give justice to my slides, what I have prepared. The illusion that are more popular due to the number of friends or followers they have. People will think that if I have 100 friends, if I have 1,000 friends, if I have 2,000 friends, I am popular, I am famous. Is it? No. That is the one cause, correct. But in reality, the number of friends or number of followers will not measure your talent, will not measure you, who you are. You should know yourself, and you should prove when the time requires. Seeing picture of a group of friends that you consider yourself to be close to, but you were not invited to join them. Yes, this is one reason. Seeing picture of happy people enjoying their life. You may see that your friend got married. He went to honeymoon destination. He went to shopping mall. He brought new car. He brought new vehicles. He had children, and what all things. He purchased a property, and he built a house. This will make you to follow him, and you also try to put all the posts in your media. That is one reason you may come to social media, which creates sadness and jealousy because your life does not seem as grand. Lack of likes to your post resulting in feeling of disappointment and decreased self-esteem. Maybe you put one photograph, your video, people are not seen, or maybe they are busy. They, due to network issues, they are getting a very few likes. What they, you have to see the face of the person who put the photo or the video. He will not have food. He will not take anything, that he will wait for the like. ज़्यादा like आ गया, 100 like आ गया, okay, पेट भर गया, खाना खाएगा अभी. So the likes and comments are not a life, dear friends. There is a lot of things to do in the life. So seeing a love interest with someone else makes you feel depressed and insecure. This is for the youth. I would want to say that your girlfriend, boyfriend, or your friend who are engaged with someone. So this is maybe this may be also another reason you may come into the social media to express your feelings. Then political posts that you don't agree with. So before 2-3 years, there was a lot of quarreling. There was a lot of heated discussion between Rahul Gandhi and Modi ji. Modi ji, Rahul Gandhi. Modi ji के पीछे 1000 लोग थे और राहुल गांधी के पीछे 1000 लोग थे. मतलब they are fighting. Finally, these two people will be going to be happy and they are friends out of the politics. But here, what we are fighting for them, we are going to die because of some reason. Okay, I will tell you one recently one example. Incident happened in Karnataka. One of the MLA's son-in-law, he posted something on Facebook regarding some religion or something on other religion. He just posted his views. Due to this reason, some people mob came and fired his house completely. The house is blasted. So see, friends, the social media is making you mad. So like this, causes are thousands. Like feelings like you can never keep up with what everyone else has. Being directly attacked about a message or picture you posted. For example, you put one post. Somebody is attacking you. So you want to prove yourself. So you will come to the social media and you will more addiction. Okay. So now I am taking one survey from you people. Now you have to be alert. There are 10 questions. Let's take a survey on social media addiction. So whenever I read the question, please give your responses by yes or no. That's it. I'm asking you yes or no. Question number 1, yes or no. Question number 2, yes or no. Understood? Okay. Come on, shut up. Social media is the first thing you do in the morning. The first question. No. Yes. Okay. I can say half of the no, half of the yes. Yes. So many yeses. I think 75% yes is there. Yes. Okay. That's very bad. If your answer is yes, please see Facebook or any WhatsApp or any Instagram updates, your status on any social media platform. It is clear sign that you are addicted on social media. Almost every addict will start their day with a morning routine of checking and pointlessly scrolling through what they have missed on social media after the long hours of sleep at night. Most social media addicts feel like they have lost a lot of time and are outdated. Thus, they want to check the status and see who has posted something new. It is not good habit. See, please, student, a friend, whoever saying yes, try to avoid checking up Facebook or Insta or WhatsApp soon after getting up. Okay, so go for the prayer. Do your all daily living activities. Do exercise. Take a breakfast, healthy breakfast, then go for social media. Okay. Coming to the second survey. Yes, again, fastest finger. You checked in everywhere you go. If you go everywhere, you're going to check in that I am traveling to New Delhi. I am traveling to Lucknow. I checked into this shopping mall. Checked into this cinema theater. I checked into this park. Yes, I'm expecting the answer from no, 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 no. Okay, okay, okay. At least some students or some friends are saying no, no, no. Okay, I think you people are not addicted. You say how many yeses are coming, how many no's are coming. Please, you have to note it. Finally, I will tell you the answer whether you are addicted or not. If you are no, yes, it is very good that you are not addicted. But people are saying yes. Well, it is understood that if you are trying to do this occasionally when you are on a holidays, but if you are doing it too often and at almost every location, you may want to seriously consider your own behavior. A lot of people, especially the youngsters, will take out their smartphone to take a picture of their food, post on social media, and check in the location before they eat. This can annoy those who are at the same table or people who are less privileged to enjoy the food. For example, 4-5 लोग खाने के लिए जाएगा एक होटल में, so one of the Facebook addictor क्या करेगा? What he will do? He will or she will take a selfie and she will take a selfie of the food also and other group members also, and they are going to post this on Facebook. But some people will be having their reservation. They are having the privacy. They don't want to exhibit this privacy. Whether it is bothering them or not, no, they will not think. They want their like, oh, you checked into this dhaba. Yeah, super. Enjoy, enjoy. They want this virtual support. They don't want this physical support where they are getting in the surrounding. Okay, so this you have to see. Need not to check every time, everywhere. One example I will tell you. One of the family in Bangalore, they were checking. They put a post on the Facebook. I am going to my native for 3 days. Tata, bye bye, and we will see on this date. Okay, this Facebook has seen by a thief, and that night they went and burglared the house, and they have cleaned up the house, stolen the valuable things, and they are coming back. They have seen everything is nothing is present in the house because of this post created lot of nuisance. Okay, so need not to have some privacy, need not to give all the details to the world because it is not required. The third point, again, I'm asking you people, you can first finger, you waste your time looking at nonsense and procrastinate. Procrastinate means you are going to talk about others, making gossip. Yes or no? No, no, no. Very good. No. Please write the question number and write yes or no. Okay. Okay. So you are not wasting your time by looking at nonsense and procrastination. Some people, yes, yes, yes. Yes, 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 yes. Okay. So coming to if yes, one thing that makes people less productive and accomplishes less in life is procrastination. And social media is a big cause and also motivator for procrastination. People can spend hours scrolling mindlessly reading news and updates that have no meaning at all. They can be a form of entertainment, but in reality, most of the things shared throughout on social media will not do any good to your life. See, when you scroll मतलब हम लोग जैसे देखते हैं सब जाते सब करते रहते हैं ना. When you are scrolling these posts, एक से बढ़िया एक पोस्ट मिलता है आपको, एंटरटेनमेंट में मिलता है आपको, मूवीज में मिलता है आपको, स्पोर्ट्स में मिलता है, WWE में मिलता है, कार्टूनिंग मिलता है, कॉमेडी मिलता है. यार आप कौन सा देखोगे? कपिल शर्मा शो देखोगे या डांस इंडिया डांस देखोगे या सारेगामापा देखोगे या कोई भी आप लाइक थिंग देखोगे? So it will never end. See, it is limitless. If you keep on watching, you will watch throughout the day, throughout the night. But it is addiction. You will lose your sleep. You are going to lose your constant mind, and you are going to lost yourself totally from the life. Coming to the fourth, I have request the delegates for answering. Who please put the question number. Fourth question, you check notification all the time, yes or no? Put a question number, then write yes or no. Yes, one yes, one no, one yes. So how many yes, 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 yes. Okay, so I can say 80, I can see around 70% yes and 30% no. If you are saying no, I think your friends are saying or anyone is saying, that's why you are saying no, na? Please respond promptly. Okay. So you check notification all time. Yep, most of the prompt answers are there. Yes, checking notification can be a normal thing to do when your phone buzzes. However, if you are checking it all the time, regardless of whether your phone buzzes or not, you may suffer serious addiction. आपका फोन बज रहा है या नहीं बज रहा है भी आप नोटिफिकेशन चेक करोगे क्योंकि आप addicted हो गए ना. People check their phone because they receive notification, and most of the time the notification are from social media, which means to say that these notifications are not really that important in your life. Yes, these are not important. Some chronic social media addicts will even have imaginary notification in their hand. They imagine their phone vibrates or receives notification. कभी कभी लगता है ना मेरा फोन बज गया. कोई आप अच्छे से पोस्ट लगाया तो नोटिफिकेशन आ गया या नहीं आ गया. It is coming or not coming, then also you will be going to check the notification. Yes, it is addiction. Coming to the question number 5. You only want to contact and talk to your friends via social media? So, this question, please send your answer with question number 5. Yes or no? Whether you are sending friend requests to people who don't know, whom you don't know, or you want to talk with them, frequently calling them, bothering them, annoying them. No, 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 no. Yeah, someone said yes. Question number 5, no. Okay, yes, it is very good if you are doing this one. If you're not doing this one, very good. This is another sign of showing that you are a social media addict, that the disorder slowly takes place in your life. Gone are the days of phone calls and text messages. पहले होता था ना, STD, ISD, फोन कॉल आते थे, दूर से फोन, हाँ जी आपका फोन आ गया, बुला रहा है, दूर से दौड़ के, क्या मजा था उस टाइम, है ना. कौन फोन किया, कहाँ से फोन किया, नाम पता नहीं चलते. वर्मा जी आपके लिए फोन है, तो जल्दी आइए, मतलब जल्दी आइए मतलब आजकल 30-30 मिनट जल्दी आया नहीं आया कोई फर्क नहीं है, कोई पैसे ही नहीं जाता है. उस टाइम 12 रुपए, 12 रुपीज पर मिनट, बाद में 6 रुपीज पर मिनट, 36 रुपीज हुआ था पहले. वन mobile, we have got the mobile network, I think BSNL, somebody has started that one, 36 rupees per minute. ISD calls are going more than 200-300 rupees. It was more stressful. Most of the people thinking about this one, we are missing someone. I need to talk with them. Just I am attending one phone call, very important. Just a second. Hello, madam. Good afternoon, ma'am. If you don't mind, ma'am, just 30 minutes, ma'am. I'll give a call. Okay. Sorry. Okay. So I was telling about. Yes. Okay. दोबारा मुझे ज्वाइन करना पड़ेगा. ज्वाइन कर रहा हूँ क्योंकि ना I am using the two devices because I don't want to miss your responses. When we are using this Google Meet, now we can't see the responses. Yeah. Now I got it. Okay. So this question, you are very good audience. You are responding me, no problem, sir. Okay. Thank you so much. Okay. So nice of you, so kind of you, sir. Santosh sir, you have got a very good audience. Thank you. Give them a round of applause. Okay. Thank you for understanding.
Yes, sir, we have more than 100 audience. And in YouTube also, more than 200 audience are listening to your class.
Yeah. Okay. So actually, I think I am going to addict to social media in lockdown. Can I overcome it after lockdown? Divya Singh is asking question. Yeah, really. You will listen to this class. Another 30 to 40 minutes of class is there. So खाना खाने के लिए भूख लग रहा है तो थोड़ा स्नैक्स ले लीजिए, खाइए, बट क्लास मिस नहीं करना, ठीक है? So really, I will make you to leave this social media once at all. Okay, you will never come back, but you will come back when really required. Okay, so coming to the sixth question, you constantly monitor the likes and shares you receive. Yes, write the question number 6 and yes or no. Do you constantly monitor the likes and shares you receive? आप देखते हो क्या? फॉर एग्जाम्पल 500 600 लाइक्स आएगा, आप वो सारे लाइक्स कौन लाइक किया, ये कौन है, इसका प्रोफाइल देखते हो, और कौन कौन शेयर किया. Yes, please respond. Yeah, already response came. No. Yes. I think we have got more no and few yes. Yes, very good. If you are saying yes, as what you have learned from the above, that checking social media rewards people because of the likes they receive from their friends, and this can be addictive. So the reward of getting likes from a picture posted on Facebook is a lot to a social media addict. They are a form of acceptance and quickly become a habit to want to check who reacts to your post. The problem will grow deeper when the addict goes into double figure likes on Instagram or platform. See, I will tell the story behind this: like, sharing, downloading, comment, subscribing, bell icon. Because when I was recently studying YouTube for my son, so I was checking that one. People will come to the YouTube and Facebook to become to post there, and also गलत रास्ते, मतलब गलत वे से बताता है फ्रेंड्स. क्या है ना, YouTube से पैसे कमा सकते हैं, Facebook से पैसे कमा सकते हैं. Yes, we can earn money, but you should have some certain criteria. You should have 1000 subscribers. 1000 सब्सक्राइबर होने के लिए आपको किसी का घर का चोरी डालना करना पड़ेगा, या आपको कोई क्राइम करना पड़ेगा, या बहुत बढ़िया टैलेंट होना चाहिए आपके पास, जो टैलेंट जिनके पास नहीं है. ओके, तो मुश्किल से आपको 50-100 सब्सक्राइबर्स मिल जाएगा, वो भी अपना फ्रेंड ग्रुप से. So this you keep it in the mind, and also watch time of the YouTube. It should go beyond 4,000 hours. Okay, तो ये सब टेक्निक है यूट्यूबर का, फेसबुक का, या जो भी सोशल मीडिया हम बोलते हैं. तो फ्रेंड्स, आपका दिमाग से निकाल दीजिए. प्लीज रिमूव फ्रॉम योर माइंड दैट यू विल अर्न मनी, यू कैन मोनेटाइज. नो, इट इज वेरी डिफिकल्ट. Very rare people out of 1000 one person will be successful in getting the money. वो भी क्या है ना, एक बार मनी आ गए तो उसमें भी उनका ये होता है, कमीशन देना होता है यूट्यूब को, फेसबुक को. So it is a waste of time. Please concentrate on your family, on you people. It is never monetizing, and it is very difficult if you are going to that track. Coming to the 7th question, are you craving for internet connection? Yes or no? Sometimes you are going to lose the network, you are going to lose the tower, and you are going to lose the internet connection. हड़बड़ाते लोग, हड़बड़ाते, अरे यार क्या हो गया. लोग सोचते हैं भूकंप होने वाला है. यस, मैंने देखा बहुत सारे लोग, नेटवर्क नहीं है. यस, मेनी एसेस आर देयर. नेटवर्क नहीं है तो वो लोग सोचते हैं अरे दुनिया खत्म हो गया. आप जस्ट इमेजिन 15 years बिफोर, 10 years बिफोर, कि कोई वाईफाई का नाम सुने थे आप लोग? नहीं. आपका पापा या मम्मी को पूछिए, या अपना बड़े भाई या बड़े बहन को पूछिए, या आप लोग भी थे उस टाइम. you can ask yourself whether have you seen these types of social media, Facebook, WhatsApp, Instagram, Twitter, etc. इंटरनेट कनेक्शन. क्या इंटरनेट कनेक्शन क्या होता है? पता ही नहीं हम लोग को इंटरनेट कनेक्शन पता ही नहीं था उस टाइम। टेलीफोन बड़ी बात है, घर में टीवी नहीं होते थे, टेलीफोन छोड़ दो, टीवी नहीं होते थे। ओके, तो आपको रामायण या महाभारत देखने के लिए किसी और के घर जाते थे ना, पापा को मम्मी को पूछिए, वो था दुनिया, वो था लाइफ। ओके, उस टाइम क्या था, एवरीबडी वाज मिंगलिंग, शाम होते ही बहुत लोग आते थे, वरांडा में आते थे, हॉल में आते थे, पार्क में आते थे, बातें करते थे, रात 10 बजे 11 बजे तक बाहर बैठते थे। आजकल रात 10-11 बजे क्राइम स्टोरी के सामने बैठते हैं, अर्नब गोस्वामी को सामने देखते हैं, और कर्नाटका में हमारा पब्लिक टीवी का रंगनाथ को देखते रहते हैं लोग, है ना। तो हम लोग हमेशा सोशल मीडिया, नेटवर्किंग, these all things are not required. We are not getting internet connection, means it is not like internet connection. You देखो Maslow's hierarchy need आप देखा होगा, this is one of the theory of psychology, needs theory. 5 needs are there. So now I want to add social media to the 6th need. Yes, it has become the need of every person, everybody. Otherwise, there is no life. But not everyone. Yes, I will accept Nisha Gupta. No, sir, I did not heard about all these social media. Not everyone. 90% of the people, yes, they are addicted. 10% still they are very much innocent. They don't know, but they are also going to be trapped on this media. Okay, so the existence of internet is not the issue. The real culprit is that with internet access, people can easily connect themselves to social media, and when there is no internet connection available, the addict will feel stressed and uneasy. Social media addict cannot live a life without internet. Even for just a few hours, they will feel anxiety and choose to enter places with an internet connection. Next, coming to the question number 8, you take photos of almost everything. Yes or no? आप लोग कई पर्सनल स्पेसेस होता है, इवन पीपल सी इन टॉयलेट दे टेक फोटोग्राफ. सी द थर्ड पिक्चर इन ट्रक ही इज गोइंग एंड इज टेकिंग फोटोग्राफ. क्या दिखाना चाह रहे हैं दुनिया को? वो गिर गए तो मर गए तो कौन देखेगा उनको? ये देखो महान भाव लास्ट फोटो में. आंसर yes, no, yes. 8 क्वेश्चन को मिक्सड ओपिनियन है. ये 4th वन है ना, नीचे वाला, इस आदमी को देखिए, बहुत बड़ा, इसको हम अवार्ड देना पड़ेगा. कि कोई मर गया उधर, उनका अंतिम संस्कार ये चल रहा है, ये लाइव में आ रहा है, या ये फोटो खींच रहा है. देखिए इनका मनस्थिति, देखिए इनकी मेंटालिटी, देखिए. द प्रेजेंट सिनारियो ऑफ द पीपल इज very poor, very bad. See students, see friends, it is not required to take photo of almost everything. Your personal life, at least you don't bring the mobile social media to your bedroom. Don't take to bathroom. Don't take to the necessary areas where you want only you, nobody others. Okay, so please, if you are, yes, there are plenty of videos and photos that were viral showing someone involved in an accident. हुआ है, क्या होता है? उनको हेल्प नहीं करते, एम्बुलेंस नहीं बुलाते, हम लोग क्या करते हैं? हाँ, लाइव करते. देखिए एक बहुत बड़ा एक्सीडेंट हो गया, मरने वाला है. अरे यार, मरने वालों को आप रोकना है, आपको उनको सेव करना है. दैट इज योर ह्यूमैनिटी. Instead of that one, you are showing to the world that someone is dying. What is the where we are going? हम लोग कहाँ जा रहे हैं? So this is ridiculous. People are, see, the bystander that did nothing besides taking photo or video for social media use instead of helping the one in need. This has become a serious issue, and society condemns the ethical of the one who chooses to share this incident on social media than giving helping hand. If you are taking photos of everything from the food you eat, the movie you watch, to constantly taking selfies and sharing them on social media, you should keep an eye on your behavior. You are addicted. The 9th question, social media becomes part of your life. Yes or no? somebody say yes, somebody say no. I accept whoever said yes. Yes, it has become part of the life. One example I would like to say, students, friends. I saw the video before 1 or 2 years. It one 5 years girl was cutting the cake on her birthday. There are 10 people who are watching this. They're all first degree relatives, parents, everybody is there. She was literally, she was taking the piece of cake to put in the mouth of mummy or daddy or anybody, dada, dadi, but everybody was taking the video, Facebook Live. That girl was literally crying. तो 10 लोगों कोई भी को खिला नहीं पाई वो. इसका मतलब she could not give the piece of cake to anyone. देखो यार, हम लोग इतना भी मूर्ख हो गए क्या? एक बर्थडे चल रहा है, सारे के सारे लोग फेसबुक में हैं, सारे के सारे लोग एक्सटर्नल वर्ल्ड में हैं, वर्चुअल वर्ल्ड में हैं. वो बच्ची का हाल क्या है? वो बच्ची किसको खिलाएगी? वो फाइनली क्या करेगी पता है? अपने आप खिला खा के सो जाएगी. दिस इज अवर सिस्टम, दिस इज अवर कल्चर. व्हाट इज हैपनिंग? सी, एक डिनर के लिए गया, सारे फ्रेंड्स, 8 लोग हैं. क्या कर रहे हैं देखो? सब लोग मोबाइल में है, या कुछ लोग मीटिंग में, इंटरव्यू में है, सब लोग सोशल मीडिया में. लाइक दिस थाउजेंड्स ऑफ फोटोज यू विल गेट एंड यू सी इन योर होम आल्सो. हस्बैंड के पास एक मोबाइल है, वाइफ के पास एक मोबाइल है, 2 बच्चे तो दोनों बच्चे के पास एक मोबाइल है. एक रूम से एक रूम, दो रूम का कितना 10 मीटर भी नहीं है, 10 फीट भी नहीं है. उनको फोन करके बुलाता है, हाँ जी पानी चाहिए, हाँ जी बर्तन धोना है, धोया नहीं धोया है, हाँ जी रोटी बन गए नहीं बन गए. अरे यार कुछ पूछ के जाओ, पूछो ना हाल क्या है. तो इतना भी हम लोग. How much time do you spend on social media each day on average? Do you spend a lot of time on them and they have become a part of your life? If so, you need to do something about it and never let this habit grow into disorder. A clear sign of how social media becomes part of your life can be seen if you have lost interest in other activities and responsibilities. You choose to scroll your phone instead of going out to exercise. You choose to waste time on Facebook rather than washing the dishes. The last question for you people. Checking social media is the first thing you do whenever you are free. मैं अभी फ्री हो गया हूँ, क्या करूँगा? मोबाइल देखूंगा, सोशल मीडिया देखूंगा, कौन लाइक किया, कौन डिसलाइक किया, कौन शेयर किया. किसी ने 10 क्वेश्चन को यस लिखा है, मैक्सिमम यस है, 1 या 2 नो है, 90% यस है. यस, आई विल से यस बिकॉज this is an addiction. So what do you do if you, whenever you are free, do you daydream about achieving your goals and visualize about realizing your dream? हमारे टाइम मैं 15 साल पीछे जाऊंगा, जस्ट अ सेकेंड, आई विल नॉट बोर यू. हम लोग क्या करते थे पता है? जब हम फ्री होते थे ना, हम दोस्तों को बुलाते थे, हम लोग खेलते थे बाहर जाके. So you know there are many games were there which were not required the assistance of this mobile, the social media. So these older games like kabaddi खेलना, लगोरी खेलना, running छुपम छुप खेलना. Okay, so many games are there, many things we were explored there. स्विमिंग पूल जाते थे, स्विमिंग करते थे, पार्क में जाते थे, क्रिकेट खेलते थे, वॉलीबॉल खेलते थे, फुटबॉल खेलते थे. आजकल क्या है, लोग है ना, 2-3 लोग बैठेगा, एक हैदराबाद में बैठे, हैदराबाद में, एक लखनऊ में, एक दिल्ली में और एक कोलकाता में है. चलो आ जाओ लूडो खेलेंगे. ऑनलाइन लूडो खेलते हैं लोग. So this is our life now. How you spend your free time will greatly determine your life. Downtime should be wisely spent for better and more valuable activities and events, not to be wasted on social media. While this is not to say that you should not spend any free time on social media at all, but you must keep a close eye on how much time you use upon social media and not to overdo it. मैं आपको मना नहीं करूंगा, सोशल मीडिया यूज नहीं करना, गेम नहीं खेलना, खेलो कूदो, बट लिमिटेशन होती है. दिन में आधा घंटे काफी है ना. यू विल सी ऑल द थिंग्स. एक टाइम फिक्स करिए, रात 10 बजे या 9 बजे. No, don't go to Facebook or don't go for social media before sleep. Any one time you can fix, afternoon or evening. Yes, that is enough. The next day you can see the remaining things of today. Okay, काफी है ये. So these 10 out of 10 You have said yes. आप ओके मैं आपको पूछूंगा, आप लोग चेक करिए अपना एसएस कितना है, नो नो कितना है। कोई 3-4 स्टूडेंट्स मुझे पोस्ट करिए अभी इधर ग्रुप में, इसमें मैसेजेस में। प्लीज सेंड योर आंसर, हाउ मेनी यस यू गॉट, हाउ मेनी नो यू गॉट। फोर yes, 6 no. Okay. See, 10 yeses I have given, 10 questions I have given. How many yes, how many no? I think you are taking time to count it. Okay, no problem. No need to post. You just see 5 yes, 5 no. Nisha Gupta, you are in borderline. Okay. See, 5 you are getting yeses, 5 you are no. You have to think. You are coming on track of addiction. If you are having less than 5, maybe you don't have that much problem with addiction. If you are having more than 5, you are in a serious problem. Serious problem matlab more than 8 is there. Totally you have to take a counseling. Totally you have to wean from the social media. Otherwise, social media will eat one day. They may kill people. Okay. So this is so many. Okay, yeah, I got so many responses. Yes, 7. See, one of the students got 7 yes, 3 no. See the statistics of the problem, dear organizers and delegates. We are getting the responses almost all more than 5. Yes, 6, 7. क्या पता है 10 भी हो सकता है बट नहीं बता रहे हैं है ना? This is really a problem. Social media addiction is a problem. We have to take care about this one. Okay, please follow. I am giving you 14 mantras, 2 weeks. You have to follow this one. One of the students, 8 yes, 2 no. Okay, this is very annoying. Please follow this. Coming slides, I will explain you. What are the negative effects of social media? Okay, everybody knows social media will have a lot of problems, lot of issues like depression, anxiety, less self-control, overeating, hive mind, fear of missing out, PTSD, post-traumatic stress disorder, low self-esteem. See, sometimes negative effects of social media will lead to health problems. Maybe it will lead to hypertension. Maybe it will lead to heart attack. Maybe it will lead to brain damage. Okay. तो बहुत कुछ प्रॉब्लम हो सकता है क्योंकि हमें पता ही नहीं क्या क्या बीमारी आ जाएगा क्यों सोशल मीडिया से हमें 5 साल से 10 साल पहले हम लोग न्यूज सुना है कैंसर हो सकता है, न्यूरोवेस्कुलर डिसीजेस हो सकता है. ओके, द कॉमन डिसीज कॉमन प्रॉब्लम्स वी मे फेस इज एंजाइटी, less self control, overeating. We eat more and more when we watch movie. अब आप लोग ऑब्जर्व करो, when you see television or mobile or any social media, you will take more food because control नहीं होता है. हम लोग को पता नहीं चलता है पेट भरा है नहीं भरा है, इतना ज्यादा खाते हैं हम लोग, बाद में पता चलता है खत्म हो गया. तो दिस इज अनदर प्रॉब्लम. ओवर क्या होता है? ओवर की वजह से बहुत सारे प्रॉब्लम्स होता है. ओबेसिटी होता है ना, हार्ट अटैक हो जाता है, many other problems. Hive mind, irrational conformity to a group thinking, fear of missing out. एक दिन आप लोग सोचो, एक दिन आपके पास कोई मैसेजेस नहीं आया, इंटरनेट है, आपके पास कोई नोटिफिकेशन नहीं आया, कोई कमेंट नहीं आया, कोई शेयर नहीं आया, कोई लाइक नहीं आया, क्या करोगे आप लोग? You will be missing out that oh my god, क्या हुआ दुनिया को, क्या हुआ, मर गए क्या सब मर गए क्या, भूकंप हो गए क्या, सुनामी आ गए क्या? These all things we are going to FOMO, FOMO, fear of missing out, PTSD, post traumatic stress disorder, low self esteem, depression. Some of the health issues caused by social media: sleep. As I told you, when you are involving in Facebook or social media using laptop, cell phone, iPad, a late night can seriously mess with your sleep pattern and habits, potentially leaving you with a sleep disorder. Late night use is also associated with stress and depressive symptoms. Depression होता है लोग को, isolation हो जाएगा, related to FOMO, fear of missing out. People, excessive technology use can lead to feeling of isolation or eventual isolation of a person due to so much time spent with technology as opposed to making real connections of human friends. Eating disorder, as I told you already, overeating. Sometimes खाना ही नहीं खाते हैं, देखते 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 फेसबुक में देखते देखते ट्विटर में होते होते खाना ही नहीं खाते, उसका बुलिमिया और वो सभी हो सकता है. Social media addiction on workplace education. Yes, you're all students and there are many faculties are there also there in this who are watching. Employer-employee relationship can be affected by reducing the interest of employees at work. कोई टास्क दिया है प्रिंसिपल ने या एचओ ने, कोई भी अपना, आप लोग सोशल मीडिया में है या टीचर ने टास्क दिया है, स्टूडेंट क्लास में क्या कर रहे हैं, मोबाइल यूज कर रहे हैं, दे आर यूजिंग एक्सेसिव मोबाइल टेलीफोन एंड दे आर टॉकिंग यूजिंग फेसबुक, इंस्टाग्राम. So it will affect on the productivity. harm नहीं होगा, खत्म नहीं होगा proper within given time. Business productivity can decrease due to lack of motivation to work. It can affect your education by diverting your attention towards virtual world rather than studies. आप लोग डिसाइड करोगे एग्जामिनेशन है 15 दिन के बाद, मैं आज से शुरू करूंगा. I will start from today onwards and I will start study sincerely. But कोई वेब सीरीज आ जाएगा, कोई नया मूवी आ जाएगा, आप लोग देखोगे, 2.5 hours gone. Then उसके बारे में डिस्कस करोगे अपने फ्रेंड्स के साथ सोशल मीडिया में, 2 घंटे चला गया, 4.5 घंटे वही आप इधर टाइम दिया तो 2-3 चैप्टर्स खत्म कर सकते थे. You would have studied. The second day what you will do? No, today I will not do anything. Today I will not check movie or anything, I will study. But you will get notification, beep, 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 beep. You will come again, you will watch this. Once you open the mobile, you just see, you will not leave that till half an hour. This is common addiction. Students who get involved in activities on social media sites while studying result in reduction in their focus of attention. This causes reduction in their academic performance and concentration to study well. See, there is one survey, 60% experience health problems related to the use of technology, 24% headache, 36% eye strain, 27% neck pain, 30% back pain, 12% upper back pain, 24% lower back pain, 21% wrist pain, 11% carpal tunnel syndrome, 9% insomnia, 2%. तो अब हम लोग अभी तक नेगेटिव इफेक्ट्स देखते आ रहे थे. Okay, we have seen all the negative effects of social media. Do you think that social media only having the bad effects, ill effects, negative effects? No, there are some positive effects also, advantages of social media. If we use it in a proper manner, through these sites, the students can establish contact with the entrepreneurs, corporate people, and can gain valuable information from them. The second point, facilitates open communication, leading to enhanced information discovery and delivery. Third point, targets a wide audience, making it a useful and effective recruitment tool. Fourth point, increase general knowledge and awareness of students. Fifth point, save time, cost by facilitating faster communication. See, the lockdown situation will make people to sit inside the house, and it is one of the curse that we are missing the education. But the social media, like the platforms like Zoom, Google Meet, what you are attending now, WhatsApp videos, YouTube videos, all these are educative. If you are using in educative manner, your knowledge will get increased, enhanced. Okay, so use properly. Why do social media? Positive things like engage parents and community in the social media, share students' work, teach digital citizenship, make global connection, prepare kids for the future, promote positive messages, connect with experts. There are so many reasons to use social media positively. If you are using it in a proper manner, you will become successful. Okay, I'm coming to the last topic in my discussion. Strategies to overcome the social media addiction. I have given 14 mantras. So do you follow? Then it will be very useful. Okay, before going to this slide, I just ask you students, please answer, how do you overcome this problem? How do you avoid this social media? लोग को कैसे फॉलो करना है, मतलब सोशल मीडिया एडिक्शन से दूर होने के लिए. जस्ट आई एम एक्सपेक्टिंग द आंसर फ्रॉम यू. How to avoid this social media addiction, or how to manage this social media addiction, or how to control this social media addiction. Taking more time with parents, very good. Making a routine, Nisha Gupta, yes. Do another activity, Nisha, Tavias, by self-challenging, yes, by self-challenging. Taking more time with friends, spending more time with relatives, make priority to be within the society. Deactivate the account. 3 months ago, I feel better. Very good. So, sir, which account you deactivated? Second account, alternative account. By time string of our use of social media, spending more time with family, talking with whom? Talking with self or talking with friends? Shweta Babu. Making routine, do other work, reading books, making daily routine, change yourself. More time play and make a routine, making to routine. Delete apps by taking, no, I have too many hours. I can't, I'm running out of time. Okay, it's the lunch time. Whenever you feel you are need to touch your phone, you should try to avoid this feeling and read some book. Okay, please read the messages. There are so many answers are there. Yes, all these are useful mantras you can follow. Okay, indulge in other activities, give more and more time with the family, communicate with friends and family. Okay, there are too many messages are coming. Give more priorities to our real life than social media. Yes, everybody is giving the right answer, and there are too many other answers also. Please concentrate. The first mantra is set time limit. Strategies to overcome the social media addiction is you please set a time limit for social media, not more than 30 minutes. 30 मिनट के ज्यादा या 1 घंटे के ज्यादा मैं यूज नहीं करूंगा और नेट ऑफ करूंगा. अभी डिसाइड करो, बहुत लोग बच जाओगे. प्लीज cancel the internet connection, Wi-Fi connection for 23 hours. I will tell you. Only 1 hour in a day after 10 a.m. before 7 p.m. Okay, 1 hour you fix the time. It is not required, my friend. Every time being in the social media, it is not required. Whenever you class, you can attend, no problem. But if you are filling every free moment of your day with social media scrolling, it's time to set some boundaries. Facebook and Instagram, they are having a very nifty feature that allows you to set a daily limit on your message. When you reach the time, a message pops up to let you know that you are gone too far. I installed that application in Facebook. After 45 minutes of use in a day from my Facebook, it will show that you have crossed the time limit of today's 45 minutes. Okay, do you want to browse? Continue. They will ask me. The same thing, you can also use this one. Please use this. First mantra, set time limit of social media. Insta के लिए 10 मिनट दे दीजिए, Facebook के लिए 10 मिनट दे दीजिए, WhatsApp के लिए 20 मिनट दे दीजिए, और बाकी आप ट्विटर के लिए 5 मिनट, और वट एवर यू हैव अप टू 40 मिनट्स और 1 hour, मोर देन एनफ. मैं बोलता हूँ आपको 30 मिनट्स काफी है. सेकेंड वन, टेक डेज ऑफ. फॉर एग्जाम्पल, इन अ वीक कोई एक दिन फ्राइडे या थर्सडे प्रॉमिस करो मैं सोशल मीडिया यूज नहीं करूंगा या सोशल मीडिया यूज नहीं करूंगा. आई डोंट यूज सोशल मीडिया. यस, दिस इज वन. देखो, स्टेपिंग, छोटा छोटा स्टेप हम क्रॉस करते हैं, वी कैन रीच टू वन achievement. Okay, yes, it is an achievement only. People will die because of addiction. You have seen blue whale game. 3 साल पहले blue whale game था. कितना बच्चे का जान गया है. How many people died because of that one? It is one of the strategy. Every day it will give one task to the child. He will do some task and they will get a score. They will get a points. Final day, the children are. You can see the newspaper. You can see, watch the videos if you want. There are so many children died because of this blue whale game. Okay, PUBG की वजह से कितने लोग पागल हो चुका है पता है. पबजी नहीं है, हाथ कांप रहे हैं, छोड़ दीजिए पबजी। टिकटॉक, योर फेवरेट टिकटॉक फ्रेंड्स, टिकटॉक नहीं है अभी, क्या जिंदगी नहीं चल रहा है हमारा, खाना पीना नहीं कर रहे हम लोग, पबजी नहीं है, खाना पीना नहीं कर रहे हैं, नहीं जी रहे क्या? Everything is possible. Okay, so take a day off. Any one day you set, don't use any social media. Second mantra. Third mantra is unfollow accounts. See, there are so many accounts are there in your Facebook, in your WhatsApp also. It is annoying, bothering you. देखो ये ले लो, ये चप्पल ले लो, ये मेज ले लो, ये बुक्स ले लो, और ये ऐप ले लो, और वो ले लो, ये ले लो, मतलब जो बेचने के लिए आता है वो लोग, they are coming to sell the things. You can use this one, you can use that one. There is some 50% of sale, 50% discount is there. Today only you have to take this. These are unnecessary. Okay, we are unnecessary piling up the tensions with us. Okay, and so many friends are bothering, so many they are not friends of us, friends, they want to talk with us. क्या जरूरी है? It is not required. Social media influencers are marketing geniuses. They know exactly how to craft the perfect image. आप एक चेक करिए, फ्लिपकार्ट में आप या अमेजॉन में आप कोई शॉपिंग के लिए मतलब एक दबाते हैं तो कोई शर्ट या पैंट या जीन्स या मोबाइल आप ढूंढते रहते हैं, आधा 10 मिनट या 15 मिनट यू आर सर्चिंग, soon after that it will come notification in Facebook that there are too many products are available in this cheaper rate. If you are searching for the flight details will come. If you are searching for the hotel like that, there are so many accounts which are giving you notification. So please unfollow the accounts, they are not required for you. Every time you take action on a social media post, the platform learns what you like and will continue to show you more of it. If there are certain accounts that you find yourself spending the majority of time on, unfollow them so they don't continue to pop up every time you log on to your account. Out of sight, out of mind. Okay, this is the third mantra. Fourth strategy, I will tell you, choose your platform wisely. See, there are thousands of platforms for you to use the social media. So you should become choosy that which is useful to me, which is not useful to me. Day to day, it is increasing popular and it is required for sometimes. Hello, please mute yourself.
आप लोग नहीं करते हैं, अच्छा उसका गाड़ी है ना आप लोग।
Yeah, okay, thank you. See, choose your platform wisely. Like you want for WhatsApp, yeah, it is needed. Sometimes officially also you are getting news, you are getting information. स्कूल कॉलेजेस का या कोई भी फ्रेंड्स का या रिलेटिव्स का मैसेज आएगा, एसएमएस आएगा, नहीं तो व्हाट्सएप आएगा, तो वो आपको जरूरी है, रखिए। ट्विटर, आप कोई फेवरेट पॉलिटिशियंस को या फेवरेट एक्टर को फॉलो कर रहे हैं, सिर्फ उनको ही आप लाइक करिए, उनको ही आप फ्रेंड में रखिए, बाकी लोग को हटा दीजिए। ओके, उसके बाद आया तो इंस्टाग्राम, फेसबुक, दोनों में एक सेलेक्ट करना। ओके, सो आई विल टेल यू, फेसबुक एंड इंस्टाग्राम आर ब्रदर्स एंड सिस्टर्स, दोनों में एक सेलेक्ट करिए, काफी है। ओके, तो फेसबुक में जो आएगा इंस्टाग्राम में वही आएगा, इंस्टाग्राम में जो आएगा सिर्फ फेसबुक में वही आएगा, तो दोनों नहीं चाहिए, हटा दीजिए, जरूरी नहीं है, क्योंकि दे आर ऑल बॉदरिंग। ओके, लाइक दैट you have WeChat, you have many other things like सोशल मीडिया में हम देखते हैं ना, बिंगो आता है, वो लाइव वीडियोस आता है, ये सब जरूरी नहीं है, हटा दीजिए। ओके, so please choose your platform. I will tell you, please have 5 enough, 5 platforms, more than enough. You will not lose, you are not going to miss anything. Okay, so trying to keep up with multiple platforms can be huge time suck, so that's why keep as much as possible minimum platforms. Fifth mantra, block out social time. Instead of reaching for your phone and checking your social account whenever you get the urge, set boundaries around when you can use social media. Make a deal with yourself that if you don't check social media during the day, you can spend 30 minutes on it when you get home from work. You can also give yourself trade-offs. For example, if you spend 45 minutes on social media, then you have spent at least 45 minutes reading the book you have been too busy to read. Okay, आप challenge डालिए, challenge अपने आप को challenge डालिए. Facebook आपने एक घंटा यूज किया, 1 hour you have used, 1 hour I have to do exercise, because Facebook should not cross my daily, my healthy habits. Okay, household activities करिए आप लोग. WhatsApp बहुत ज्यादा यूज कर रहे हैं, बंद करिए उसको, नोटिफिकेशन बंद करिए. ओके, ग्रुप्स है ना, हमारे पास फालतू का ग्रुप होता है, आप चेक करिए सब लोग के पास 10-15 ग्रुप है मैक्सिमम. इफ आई आस्क द क्वेश्चन, आई डोंट हैव टाइम, मे बी 50 or 60 ग्रुप्स आर देयर, एनी वन स्टूडेंट आई एम आस्किंग. ओके, सो यस, अननेसेसरी ग्रुप. 4 लोग है, 2 लोग का ग्रुप होता है कभी कभी. 2 लोग का ग्रुप क्यों चाहिए भाई? 3 लोग को ग्रुप चाहिए, 4 लोग को ग्रुप होता है. Whether it is required? No, nothing. ग्रुप कब चाहिए पता है? कम से कम 30 लोग है अपना ऑर्गेनाइजेशन में, अपनी क्लासरूम में 30 स्टूडेंट है, 60 स्टूडेंट है, आप ग्रुप बनाइए. ओके, 3 लोग है और आसपास अड़ोस रहता है, वो लोग का ग्रुप बनाए. क्या यूज है? प्लीज रिमूव दिस, कट ऑल दिस ग्रुप. 6 1 स्टार्ट ए न्यू हॉबी. देखो यार कितने हॉबीज है, थाउजेंड्स ऑफ हॉबीज आर देयर. सोशल मीडिया इज नॉट योर हॉबी. रीडिंग बुक, photography, painting, drawing, walking, cycling, exercises. Okay, so many. Swimming जा सकते हैं आप लोग, skipping कर सकते हैं. ओके, बात कर सकते हैं, चिट-चैट कर सकते हैं लोगों के साथ, फैमिली के साथ टाइम स्पेंड कर सकता है. ओके, बच्चों के साथ खेल सकते हैं. These all are the hobbies you can shift from social media. This is the 6th one. 7th one, build an in-person community. बहुत थक गए ना आप लोग फेसबुक से, ट्विटर से, व्हाट्सएप से. टेक अ ब्रेक. सर्च ग्रुप इन योर village, search group in your city, search help group in your town. You will get lot of in-person community. Same thinking groups are there. They are coming, they are joining. You spend time with them 1 hour in a day. It is a very healthy discussion, and you will be avoiding the social media and see the charmness in your face. What did people do before social media existed? जरा सोचिए, अपना पापा को पूछिए, मम्मी को पूछिए. आप लोग मोबाइल में 24 घंटे मोबाइल में रहते हैं ना. पहले क्या करते थे लोग? मोबाइल नहीं होता था, वो लोग क्या करते थे? लोगों के साथ मिंगल होते थे, बातें करते थे, शेयर करते थे, एक दूसरों का गम या एक दूसरों का सुख शेयर होता था. अभी क्या है, कोई रियल लाइफ का फ्रेंड्स नहीं है, सारे वर्चुअल लोग के साथ हम लोग डिस्कस करते हैं. इट इज नॉट रिक्वायर्ड, जरूरी नहीं है. मैंने आपको एग्जांपल पहले ही बताया, 5000 फ्रेंड्स है उनके पास, वो एक पेशेंट आईसीयू में है, उनके पास उनकी वाइफ और उनका बेबी है. मरने के बाद 15 लोग आया, बस 5000 लोग डिलीट हो गया. दिस इज मोर देन एनफ एग्जांपल फॉर यू पीपल. कमिंग टू द 8th वन, डोंट मिक्स बिजनेस विद प्लेजर. आप लोग बिजनेस करना चाह रहे हैं फेसबुक में या यूट्यूब में, यू वांट टू सेल समथिंग दैट यू आर हैविंग वेरी रियल हैंडीक्राफ्ट, यू आर हैविंग वेरी गुड हॉबीज, टैलेंट, यू वांट टू सेल योर प्रोडक्ट. यस, बिजनेस के लिए अलग से अकाउंट होना चाहिए, प्लेजर के लिए अलग अकाउंट होना चाहिए, या अपना हॉबीज को अलग से आप देखिए. बिजनेस को और प्लेजर को दोनों मिक्स नहीं करना. इफ यू यूज सोशल मीडिया एज अ पार्ट ऑफ योर जॉब, इट्स एसेंशियल दैट यू क्लियरली डिफाइन द लाइन बिटवीन द वर्क एंड पर्सनल यूज. Keep your social media activities to the company pages when you are at work, and try not to link any company accounts to your personal accounts. This is very dangerous. 9th mantra is use scheduling apps. This is one of the tricky. If you are able to log on to your social account, create a new post, and then log out without scrolling throughout your feed, you are doing better than most. Using a scheduling app allow you to create a post, schedule it for a certain day and time, and move on with your life. Although this does not work for all social accounts, you can keep the scheduling app. So apps should have messages, schedule, then only you can follow that one. 10th mantra is link directly to the group. Are Facebook groups your why? Facebook groups offer great community engagement around a specific topic or interest, but they are also another way to get drawn into the platform. Bookmarking the URL to take you directly to a group can help keep you from being distracted. See, आप 100 लोगों को मतलब सर्च करते जाने से पहले सर्च में जाइए, URL डालिए, आपको डायरेक्टली फेसबुक ग्रुप मिल जाएगा. बात करिए, काफी है ना. So link directly to the group. You are going to avoid the addiction. 11th mantra. So I'm having only 4 or 5 slides. So just have a 5 minutes. I will be leaving you. So people may be scolding, sir, itna time le raha hai. It is very useful topic. That's why I'm just explaining in detail. Okay. So just 5 minutes. I'm finishing, my dear delegate. Manage notification. Is your phone buzzing every 5 minutes with alert about your likes, comments and follows? Silence and noise. कोई नॉइस जरूरी नहीं है, साइलेंट डालिए. वाइब्रेशन भी जरूरी नहीं, क्योंकि वाइब्रेशन के वजह से बहुत सारे हेल्थ प्रॉब्लम आता है. ओके, इवन द मोस्ट डिसिप्लिन्ड अमंग अस कैन हैव अ हार्ड टाइम इग्नोरिंग ए कांस्टेंट इन्फ्लक्स ऑफ सोशल मीडिया नोटिफिकेशन. टर्निंग ऑफ your notification will help keep you from reaching for your phone every time you hear a ding dong. Okay, so whenever you take a new app, it is required for you. Maybe you are taking for a navigation, you are going for a map, you need a medicine like 1 mg, or you need a hotel search, Oyo, Ola, travel चाहिए, travel के लिए, या रेड बस के लिए आपको बस चाहिए, ऑटो, ओला ऑटो चाहिए, या जो भी ऐसा ऐप्स है, ये जरूरी होता है. ओके, तो ये सारे ऐप्स का नोटिफिकेशन भी है. हमें नोटिफिकेशन जरूरी नहीं है. ओके, तो क्यों जरूरी नहीं, मैं बोलता हूँ आपको. नोटिफिकेशन का फायदा क्या है? वो लोग आपको नोटिफिकेशन भेजेगा, किस लिए भेजेगा? दे विल आस्क यू 10% डिस्काउंट दे रहे हैं, 20% डिस्काउंट दे रहे हैं, बुक होटल, बुक ओला, बुक उबर, book this medicine, take this food, take this product, that product, this product. जरूरी नहीं भाई, हमें जरूरी है वो ले लेंगे हम. नोटिफिकेशन बंद करना. ठीक है. नेक्स्ट 12th mantra is create physical distance between you and your devices. I'd like to ask you one question. How many of you sleep with mobile? मतलब आपकी बेड के पास रख के सोते हो? If yes, please send yes. If no, please send no. One student, yes. Saurabh Chakravarti. You sleep with mobile. You married with mobile. Okay. No. Pooja. Kasturi, yes. Nisha, yes. Mansi, no. Akash, yes. Yes, yes. Thank you. Sanju, no. Madhu, yes, 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 yes. No. Yes. क्या है ये? इतनी यस है. Yes. You people are sleeping with the mobile. मोबाइल देखो बहुत डेंजरस है, उसके साथ सोना नहीं है, क्योंकि आप सिर के पीछे रखिए, मतलब सिर के नीचे रखिए, ब्रेन को प्रॉब्लम होता है. पैकेट में रखिए, हार्ट को प्रॉब्लम होता है. नीचे पैंट में रखिए, किडनी को प्रॉब्लम होता है, पेट को प्रॉब्लम होता है. आप थोड़ा, ठीक है, थोड़ा दूर में रखिए. देन ऑल्सो देर आर सो मच ऑफ vibration, so much of energy which is coming, na, it is very bad to our health. So try to keep the mobile as much as possible 20 feet distance from you. कितना? 20 feet distance from you. चार्ज के लिए रखते हो, रात में रखते हो, सुबह निकालते हो? No. It is a very dangerous act for mobile. कंटिन्यूसली चार्ज करना मोबाइल का परफॉर्मेंस डाउन करेगा. कंटिन्यूस चार्ज करते रहते हो आप लोग, मोबाइल काम नहीं करते अच्छे से. ओके, तो चार्ज मैक्सिमम 2 आवर्स, जितना जल्दी 100% हो जाएगा निकाल दीजिए और उसको हटा दीजिए. जब आप सोते हैं, डोंट टेक द मोबाइल फोन इन योर बेडरूम. आई एम टेलिंग यू, प्लीज कीप समवेयर, और एल्स 9 o'clock or 10 o'clock द नाइट स्विच ऑफ द मोबाइल. और एल्स स्विच ऑफ नहीं करना, क्योंकि कोई इमरजेंसी फोन आया होगा, आते हैं ना, तो उसको साइलेंट रखिए, नोटिफिकेशन को बंद करिए, इंटरनेट को जरूर ऑफ करना है. ठीक है. डू यू स्लीप विथ योर स्मार्टफोन नेक्स्ट टू योर बेड? Stop it from today, and it is not a good habit. Last 2 mantras I am giving you. Don't feed the troll. जो भी आएगा, देखिए अभी अतरस का ये अगर रेप केस आ गया, ओके, और अभी सुशांत सिंह राजपूत का सुसाइड केस आ गया था. अभी वो क्या है ना, टीवी चैनल का टीआरपी का आ रहा है, और वेस्ट बंगाल में दंगा हो रहा है. ये सब हमारे लिए जरूरी है या नहीं, आप देखिए. ठीक है. मोदी ने क्या बोला, राहुल गांधी ने क्या बोला, ममता दीदी ने क्या बोला, और अपना योगी आदित्यनाथ योगी जी ने क्या बोला है, वो सब हमें जरूरी है या नहीं, आप चेक करिए. जरूरी है तो देखिए. डोंट फीड ऑल द ट्रोल. ओके, so need not to give hype for all these things, because ये हमारे साथ नहीं है, नहीं रहेगा, और सिर्फ हम ही हमारे साथ रहेंगे, हमारा फैमिली हमारे साथ रहेंगे. The last mantra is delete or deactivate your accounts. If you don't require, put it in dustbin. Okay, dustbin मतलब मोबाइल लेके डस्टबिन में नहीं डालना, ठीक है. ऐप को हटा दीजिए. If all else fail, you can always delete your social media account. Remember, social media is not on Maslow's hierarchy of need. As I told you, Maslow's hierarchical need में 6th need डाल रहा है, उसको जरूरी नहीं है. Social media जरूरी नहीं है. It is not essential for your life. If social is affecting your mental health and happiness, it's time to pull the plug. You can either delete the app of your phone and remove any bookmarks from your computer, or you can go completely cold turkey and deactivate your account. If you don't require Instagram, delete it. Okay, पहले एक आता था गेम आता था एंग्री बर्ड, जरूरी नहीं है. कैंडी क्रश सागा. Actually, I want to say one thing. I was addicted to Candy Crush Saga before I think 5 years. मैंने बहुत खेला था. 450 या 500 स्टेज तक गया था. मैंने सोचा शायद 500 खत्म होगा. मतलब पहले शुरू किया ना, 100 में खत्म हो जाएगा, मैं जीत जाऊंगा. 200 स्टेज तक गया, खत्म नहीं हुआ. 400 गया, खत्म नहीं हुआ. ये एक स्टेज जाने के लिए एक महीने चाहिए था. पता नहीं क्या क्या कमाल है उसमें. और उस टाइम डिलीट ही कर दिया था मैंने कैंडी क्रश सागा. बाद में पता चला 2-3 साल के बाद लोग 1500 स्टेज तक गए हैं कैंडी क्रश सागा में, है ना. तो इट इज एंड आल्सो पबजी, ये सब है ना, बहुत सारे गेम्स है, बहुत आगे भी आने वाला है. ये सब जरूरी नहीं है फ्रेंड्स. प्लीज finally please understand, technology is there to help us move forward. It is not created to waste our time and make us less productive. Social media can be a great way to connect with people, but you must not neglect the importance of physical communication with others too. Never let these online social platforms take away your precious time or control your life. You should be the one that controls them as a tool. If you found yourself spending too much time on social media and are addicted to it, follow the advice above, get rid of the disorder, and gain back the control over your life. We wish you a good luck for your future. Dear students, if you want this PPT, I am sending to your sir, Santosh sir, please get it from them. It is very useful, and follow this one. And these are the references. Thank you so much for providing me opportunity, for giving some inputs regarding the social media. And I must congratulate and thank Associate Professor Santosh SU and Shweta Rani Madam for giving opportunity for me to give this class, and all the delegates. You are very active and very enthusiastic. Thank you so much. Namaste.
Thank you, sir. Thank you so much. So if any of you have questions, any question related to the topic, please send it in the chat box. No questions, I think. Okay. Okay, sir. Naveen sir, thank you very much. You not only gave knowledge about us, you made us aware of our addictions, and you also entertained us with a great sense of humor and making this program more interesting. Thank you, sir. Thank you so much for your valuable time and your. Uh, thank you, sir. Thank you so much.
Yes, I must thank the management of One Beat College of Nursing, One Beat Medical Sciences.
Okay.
Speaker Elakuan Bhaskar sir also. Thank you so much, all the delegates. Thank you.
Thank you, sir.
Thank you very much, Naveen sir and Bhaskar sir, for giving the wonderful this for our students, for sharing your knowledge. And the class was really, it was wonderful. And we are seeing the chat box that everyone were happy, and it was clearly understood. All the participants have understood the topic very well.
Hello. Hello. Am I audible?
Yes, yes, you are audible, ma'am.
Once again, I would like to thank you all. Thank you all the participants. Thank you all the speakers and our management, everyone for giving this opportunity. And I think through this webinar, we have really given a meaning to the World Mental Health Day. We just came to know about our addictions actually, rather than others, how we are addicted to social media. Thank you, Naveen sir, for making us aware about this. And Bhaskar sir had gave a clear-cut explanation about how substance abuse is affecting us and what are the strategies we have to do to overcome this. I think our vice chairman sir is online. Manjeet sir, can you please share your views over this? Hello. I would like to invite Dr. Manjeet Singh sir to share his views over this webinar. Hello sir, am I audible to you?
I think sir is mute. As mute.
Sir, your mic is mute, sir. Hello.
Miss Shweta,
Yes, sir.
yeah, Manjeet sir, let Manjeet sir to speak.
Yes. Now,
Yes.
now you can hear me?
Yes, sir. Yes, sir. You are audible.
Yes, sir. Now audible, sir.
Yes. So thank you very much for, I think you all might have enjoyed this very fruitful session. And I wish that all the participants might have gained a lot of knowledge from this. So the speakers, Mr. Santosh, Shweta ji, all the faculty members, a big thank you to all of you, and especially to the participants, because I do feel, and I'm the strongly of the opinion that this webinar, the new world, now the world is changing very fast, and due to this COVID virus, we are at this, we have adopted this system of imparting knowledge. What you teach, what you preach, what you plead. One thing I am of the firm opinion that you all should be careful about knowing that what you are doing and why you are doing. And this imparting of knowledge, this is the basis. We at One Beat College of Medical Sciences, we have made it a point to make this institution a thought-provoking institution. As the topic of today's agenda is concerned regarding this mental health, I must add it that what you think, what is your day-to-day life, this is greatly impacting your knowledge. So my sincere advice to you all that our thoughts should be very much positive, and because this is directly, it is going to make your mental capability very strong. It is very easy saying than doing, but we have to keep striving, keep trying to inculcate this feeling of thinking very positive. Positivity should be the core belief in our system. So without taking much time, I'm very glad and happy and very thankful to all of you that this webinar you have all conducted, and I hope the participant have gained sufficient knowledge from this, and they should share this knowledge. In our country, the problem is we don't believe in the concept of sharing. Either it is wealth, either it is ideas, either it is knowledge, anything. When you share something, it means you are adding to that knowledge. sharing is believing. When you share something means you believe in this knowledge, and this is the process through which this knowledge can be expanded to lots of people. So at the end of this, I thank you all, and I wish that many more webinars, Mr. Santosh, you should hold, and all the best to you. Thank you very much.
Thank you very much, sir.
Thank you, sir. Thank you, sir. Thank you very much. As always, you have encouraged us. Your words were very motivating, sir. Thank you so much.
Okay, thanks.
Once again, I would like to thank you, all the speakers, the management of One Beach College of Medical Science, all the participants, delegates, and my fellow colleagues. I would like to thank you very much for joining us this webinar and making this successful.
One
I
second.
think now we have understood the theme of yes, sir. Yes, sir.
Sorry, don't conclude the session. Just one announcement
Yes, sir,
that
sure.
I want to mention this one. Out of 300 people, one or two messages I want to read. So thank you so much for
Yes,
taking
sir.
class for phone addicts like me. I definitely want to change, really useful. I thank this webinar organizers to arrange this session. So this message, why I am reading, you can get in the chat box. See, if we say anything, it is useful to one person or two person, it will transform to 10. 10 will transfer to 100. 100 will transform to 1000. Like that, there are so many students who are addicted. See, they are telling that I was really addicted to the addiction, sir, phone addiction. It was very helpful. Now I will change my lifestyle. So this is very good topic, Mr. Santosh, you have chosen. And give a round of applause all the participants for Mr. Santosh and Shweta madam and all the organizers of today's, and also someone is asking feedback. So you can look into that, sir. Thank you.
It all happened because of you, Naveen sir and Bhaskar sir, because you people agreed to us. That's why we have conducted this webinar. Otherwise, it would have not been done. We are very thankful for your support also. Thank you, Naveen sir.
Feedback form somebody is asking. Please see that form. Okay.
Yeah, we are sharing that feedback forms.
Dear participants, we have
Dear
shared the
participants, you will
feedback
get the
form
feedback forms
in
through.
the chat box.
We have
We
shared the
have
feedback
shared.
form. You can get. Okay, we have shared the feedback form, and you can fill that feedback. And within 3 to 4 days, you all will receive your certificates through to your registered email IDs. If any doubt, you can contact us. You people have our contact details. You can contact, and we'll provide you your certificates within 3-4 days.
Thank you so much. Shall we leave?
Okay, sir.
Okay. Thank you.
We are going to end the session.
Thank you once again. Thank you so much for everything.